Me getting up at like 2. Hopefully, these classes will put me on my track. I love your
Definitely.
face. I'm eyeing INICT also, sir. Not giving up so fast. I felt good after doing SPM, sir, because a భయంతో నేను స్టార్ట్ చేశాను. It felt very easy. I felt like I'm reading a storybook. Hepatitis is
First under the
sir, hepatitis is clear గా it's there in SPM. ఏది ఫస్ట్ వస్తుంది, ఏ తర్వాత వస్తుంది, వాట్ ఇస్ పాజిటివ్, వాట్ ఇస్ నెగిటివ్. నేనే నా హ్యాబిట్ నుంచి మరి కేరింగ్ చేసుకున్నాను. I'm actually enjoying studying, sir. Antibiotics, sir, 3 revisions here, sir. 3 revisions. Just to have at least 65% in my mind. It's a very volatile subject. So just one doubt, sir. నేను ఎంతో వెతికాను సార్. చార్ట్ స్క్వేర్ ఇంకా స్టూడెంట్ కి ఎగ్జాంపుల్స్ ఇస్తే ఎట్లా ఆన్సర్ చేయాలి అర్థం కాదు సార్. హై మొత్తం వెతికాను సార్ నేను
ఏంటిది
యాప్ సార్, కానీ వొకాబులరీ అర్థం కాదు. What I understood is this comparison between two things. It's student. He's not talking efficiently. Now you check for him, which is generate 800 plus. They would force na go to share. It's not available.
Good evening to everyone and welcome to today's wonderful evening with Dr. Murali Bharadwaj. Past 6 months we had been laboring, but ultimately the time of harvest has come. There are some subjects which we never read. There are some subjects we are very good, but it doesn't matter where we are good or where we did not read at all. But this last 72 hours or 48 hours is very, very precious. So I thought, let me be your classmate, study with you, hold your hand. In this life, can there be more privilege than spending the time with wonderful guys like you? Believe only one thing. Those who are attending these sessions are the toppers of tomorrow. I can vouch for you. So let's make the great beginning. To do quick, very, very, very rapid revision is an art. We should not be too clinging, but we need to just run through so that your general confidence should improve. So with that, let's make the great beginning. Now, doctor, let's start with biochemistry. 1 hour, one subject we will try to finish. That should be our goal. Vikas Raj, Latwal, Yudhishthir Latwal, and many more who are all online. Can you please punch? Is the voice loud and clear for all of you? And also please inform all your friends, whoever you know. Vitamin B1, all of you know it is thymine pyrophosphate. And what are the conditions where it is important? I mean, coenzymes. Branched chain keto acid dehydrogenase, right? Branched chain keto acid dehydrogenase, ketoglutarate dehydrogenase, pyruvate dehydrogenase, and transketolase. These are the 4 enzymes that you need to remember. 1 minute. Let me change my pen. So these are the 4 things you need to remember. Branched chain keto acid. So ketoglutarate dehydrogenase, pyruvate dehydrogenase, and transketolase. And all of you know what are the branched chain amino acids? Leucine, isoleucine, and valine. They are the ones, and if at all there is any problem in this, what you get is called maple syrup urine disease is what you need to remember. Then vitamin B2 is riboflavin. Take my point, doctor. 1 MCQ is going to come from vitamins, invariably out of the 200 questions in tomorrow's NEET PG. Vitamin B2, riboflavin, succinate dehydrogenase reaction, which you need to remember. FAD and FMN are derived from riboflavin. Typically, it leads to cheilosis, magenta tongue, and corneal vascularization is what you need to remember. So this is the magenta tongue and neovascularization of the cornea. So succinate to fumarate also you require FAD. Then what is Hartnupp's disease? Hartnup, 4 points about Hartnup. Many times Hartnup was asked in the past NEET PG exams, doctor. Autosomal recessive, neutral amino acid, that is tryptophan transporter in the proximal renal tubules is affected. So neutral amino aciduria that will increase the tryptophan to, there is an increased tryptophan production that lead to niacin. So that's the reason pellagra-like symptoms will be there, and you treat with high protein diet and nicotinic acid is what you need to remember. Then comes vitamin B5. B5 is also called pantothenic acid. And burning feet syndrome, distal paresthesias, for coenzyme A you require pantothenate. Vitamin B6, it's called pyridoxine, converted to pyridoxal phosphate. It is used in transamination reactions, decarboxylation, glycogen phosphorylase. You require pyridoxine. Please don't forget. This is a very important MCQ. Where do you require vitamin B6? కొంచెం పైన పోయి చెప్పొస్తావా వాడిని బంద్ చేయమని ఎక్కడ పడుతుంది ఒకసారి చూడండి glutathione, cystathione, heme, niacin, histamine. For all this you require vitamin B6. Norepinephrine, serotonin, epinephrine, dopamine, catecholamines, GABA. You require vitamin B6. And vitamin B6 deficiency, there is pyridoxine dependent seizures, which can be relieved by giving pyridoxine. Isoniazid therapy, OCPs can cause pyridoxine deficiency. Sideroblastic anemia and associated with pyridoxine is what you need to remember. Now, doctor. So, serotonin synthesis, neurotransmitters, transaminases, all these things you need to remember pyridoxine. Quickly, vitamin B7. B7 is also called biotin. Biotin for carboxylation, pyruvate carboxylase, propionyl-CoA carboxylase. Everywhere carboxylase means vitamin B7, which is biotin. So typically raw egg white contain avidin, and avidin is the one responsible for the biotin deficiency. Is a quick point that you need to remember. Then vitamin B9 is also called folate. Folate is fundamentally absorbed in jejunum, not duodenum. It leads to macrocytic megaloblastic anemia, and what is very important thing, hypersegmented PMNs. Classical feature of the the folate deficiency and megaloblastic anemia. There is an increased homocysteine. So what is the difference between folate and vitamin B12? Both of them lead to megaloblastic anemia. But normal methylmalonic acid is feature of folate deficiency. Whereas methylmalonyl-CoA that is B12. And typically don't start it after conception. 1 month prior to conception only you should start supplemental folate to decrease the risk of neural tube defects. And give 9 months of pregnancy. Folate is being given. What are the 3 drugs and folate deficiency? You'll remember phenytoin, trimethoprim, methotrexate. Phenytoin, trimethoprim, methotrexate, and folate deficiency is what you need to remember. So, doctor, vitamin B12, cobalamin, methionine synthase.
So, phenytoin, trimethoprim, methotrexate, also pyrimidine.
Vitamin B12 is methionine synthase. It transfers methyl group to methyl cobalamin. Then one more place where you require vitamin B12, methylmalonyl-CoA mutase. It is important for DNA synthesis, is what you need to remember. So this is how homocysteine to methionine, typically there is a role for vitamin B12. Similarly, there are certain okay. Valine, leucine, methionine, threonine, odd-chain fatty acids, cholesterol. When all of them metabolize, 3-carboned propionyl-CoA will come, and that will convert into methylmalonyl-CoA, and that need to be pushed into succinyl-CoA, one of the intermediate of citric acid cycle. So this is the place where methylmalonyl-CoA becomes succinyl-CoA. You require vitamin B12 is what you need to remember. Very nice to see 56 online students. Good, doctor. Dr. Surender, Yudhishthir, Vinisha, Shubham, everybody. Good, doctor. Last moment, high ATP. You need to be like Chadavu Pisacham. You should be like a Bhutam. That kind of energy you need to get to what you call finish the syllabus. No point in sitting desperately crying about what is going. Nothing is going to happen. इतने दिन नहीं रो के अभी रोए तो क्या मजाक है. चलो मिलके पढ़ेंगे. जो भी याद आएगा आएगा. I am giving you purely. This is a pure cocaine, doctor. Sure shot आने वाला cocaine. So vitamin B12 में क्या रहता है? Hypersegmented PMNs, Homocysteine, methylmalonic, both of them increase. By mistake, if there is vitamin, whenever there is any megaloblastic anemia, only if you give folate, anemia resolves. But neurological things that happen due to vitamin B12 deficiency don't resolve. That's the reason they will worsen. That's the reason whenever megaloblastic anemia is there, don't just give folate alone, but folate plus vitamin B12 is what you need to remember. So what leads to vitamin B12 deficiency? Celiac sprue, enteritis, diphyllobutrum latum, echlorohydria, bacterial overgrowth, pernicious anemia, gastric bypass, Crohn's disease. Even metformin can cause vitamin B12 deficiency is what you need to remember. Then comes vitamin C. Vitamin C का main function क्या है? Typically, it will facilitate iron absorption by reducing it to Fe+2. And all hydroxylases have vitamin B12, dopamine hydroxylase that convert dopamine to norepinephrine. Similarly, for methemoglobinemia, to reduce Fe+3 to Fe+2 also you require vitamin C is what you need to remember. Then comes vitamin D. D has cholecalciferol, ergocalciferol. What is the main function of it, doctor? What is the enzyme there in the kidney? 1-alpha hydroxylase. It converts 25 hydroxy vitamin D into 125 dihydroxy vitamin D. And typically it increases intestinal absorption of both calcium phosphate vitamin D. And typically what regulates it? Parathormone level, low calcium, low phosphate will lead to high 1-alpha hydroxylase and increase the 125 is what you need to remember. So doctor, vitamin E deficiency lead to hemolytic anemia, acanthocytosis, vitamin E, please don't forget. Even vitamin E can cause demyelination of posterior columns can occur in vitamin E deficiency, just like in case of the vitamin B12. And so this is they are the 2 points. Mainly remember acanthocytes and vitamin E. Then vitamin K, gamma carboxylation of which amino acid residues, doc? Glutamic acid residues. What are the vitamin K dependent factors? 2, 7, 9, 10, 2, 7, 9, 10, 2, 7, 9, 10. And protein C and protein S are the antithrombotic factors. And in early part of the vitamin K deficiency, early phase may, factor 7 has lowest half-life. So first to fall. And that lead to rise of only PT. Late stage of vitamin K deficiency may both PT and ABDT increase. Very important thing. Vitamin K is not there in breast milk. That's the reason exclusively breastfed will develop hemorrhagic disease of newborn who are typically having low vitamin K. Is what you need to remember. That's the reason we give vitamin K injection. Zinc is favorite question. Zinc typically is part of the zinc fingers, and wound healing you require zinc, and any zinc deficiency lead to male hypogonadism, acrodermatitis enteropathica, and zinc also predisposed to alcoholic cirrhosis is what you need to fundamentally remember. So tomorrow's exam they will give you acrodermatitis enteropathica lesions and ask you to identify that it is due to the zinc deficiency is what you need to remember. Abhi aa gaya daru wala. Nischal is saying super class sir. Class ayyaka PDF ibbandi. Nischal and everybody 9000868356. We give you a spot subscription activation to the Score learning app, doctor. Spot. And it is also free. 3 days we give you free activation until 5th. After that you pay fee. If you get seat, it's okay. All right. So 3-day activation we will give freely. If you want that, please WhatsApp 9000868356. Only for 3 days we will give a so that all these notes is available in the Score NEET PG app. So, doctor, please 9000 our helpline. You can WhatsApp. You get a free Score app activation, full Score app activation for 3 days. You can enjoy until the exam. All right. Now, Fomepizole, what is it? It is an inhibitor of alcohol, not aldehyde dehydrogenase. Please remember. Similarly, disulfiram, aldehyde, acetaldehyde. Fomepizole is alcohol. Dehydrogenase is what you need to remember. Now, doctor, rate limiting enzymes. Amma. Sachinam. This chadavalante. Kani gurtupeట్టుకోండి, easy gurtupeట్టుకోవచ్చు, ఏం టెన్షన్ లే. No tension, but one MCQ aayega doctor from this in biochemistry, be very sure. Glycolysis, phosphofructokinase 1. Gluconeogenesis, fructose 1,6-bisphosphorylase 1. Citric acid cycle, isocitrate dehydrogenase is rate limiting. Glycogenesis, glycogen synthase. Glycogenolysis, glycogen phosphorylase. And HMP shunt, G6PD. De novo pyrimidine synthesis, carbamyl phosphate synthase 2, not 1. One is in urea cycle. De novo purine synthesis, but in de novo purine synthesis, carbamyl phosphate synthase 1 will be there, but that is not rate limiting. What is rate limiting? Glutamine, phosphoribosyl pyrophosphate, PRPP, amido, urea cycle. Urea cycle में carbamyl phosphate synthase 1 is rate limiting. Pyrimidine में 2 is rate limiting. But if you take de novo purine synthesis, what is a rate limiting enzyme? Glutamine, phosphoribosyl pyrophosphate, amido transferase. Then fatty acid synthesis, acetyl-CoA carboxylase. Fatty acid oxidation, carnitine acyl transferase is rate limiting. Ketogenesis, HMG-CoA synthase, not lyase. It is synthase, but not lyase in ketogenesis. Cholesterol में HMG-CoA reductase. Reductase is cholesterol. What is Vinicia's favorite? Generally, we talk cholesterol reduction. Remember reductase, right? The other one is synthase. Very good, doctor. Now, doctor, what are the sites of metabolism? Amma, okka question, compulsory, one MCQ, compulsory. Mitochondria में क्या क्या होता है? फटाफट बोलो बेटा. Beta oxidation, acetyl-CoA production, TCA cycle, oxidative phosphorylation, ketogenesis. Cytoplasm में glycolysis, HMP shunt, cholesterol synthesis, and proteins, fatty acid, nucleotide, all synthesis cytoplasm. Breakdown, mitochondria. M is maranam, breakdown. Cytoplasm is jananam, synthesis. Both mitochondria cytoplasm, heme synthesis, urea cycle, gluconeogenesis. So examiner will ask which enzymes in these 3 cycles are cytoplasmic and which are mitochondrial. You need to be very, very sure about. Now another favorite question of the examiner is ATP production. 32 net ATPs are produced by malate aspartate shuttle when there is an aerobic metabolism of one glucose molecule. 30 net ATPs by a glycerol 3-phosphate shuttle, mala shunt, other is glycerol 3-phosphate shuttle in muscle. Muscle में 30, heart and liver में 32. That's the point you need to remember. So quickly, glucose metabolism में क्या होता है? 2 pyruvates, 2 ADP, 2 NADH. Pyruvate decarboxylation, 2 pyruvates will become 2 acetyl-CoA, 2 CO2, 2 NADH. Citric acid cycle में 2 ATP, 6 NADH2, 2 FADH2. Oxidative phosphorylation में ultimately 10 NADH2, FADH2 will convert into 30 to 34 ADP depending upon whether it is muscle or heart and liver. Heart and liver है तो 32, muscle है तो 30, heart and liver है तो 32, muscle है तो 30. Somehow you need to remember. Then what are the activated carriers? NADH, NADPH, FADH2 for electrons. Coenzyme A, lipoamide for acyl groups. Biotin is for carbon dioxide. Tetrahydrofolate for 1 carbon units. SAMI boy. SAM is for methyl group. And thymine pyrophosphate for aldehydes. Gurtunte danadrishtam, lekunte manadrishtam, bus only adrishtam. Understand? Now comes quick question, doctor. Examiner कल पकड़ के पूछेगा आपको. Hexokinase versus glucokinase. Both of them convert glucose into glucose 6-phosphate. In the liver is glucokinase. Other tissues में hexokinase. Liver में glucokinase. Generally you can remember liver बोले तो क्या होता है hepatic. H में H नहीं. Hepatic में hexokinase नहीं मगर glucokinase. Whatever the way. Making an easy method in the.
I thought glucose was more important. Liver is a major organ.
All right. Liver lead to hypoglycemia, so glucokinase. Hexokinase का काम क्या है? To sequester the glucose in tissues, so that even when the glucose concentration is very low, it can be used. Whereas at high glucose concentrations, glucokinase helps to store the glucose in liver. So high glucokinase in liver. Glucokinase deficiency is the cause of maturity onset diabetes among young, MODY, and also gestational diabetes. Hexokinase in most tissues except liver, except pancreatic beta cells. Glucokinase is in liver, beta cells of pancreas. Hexokinase has got a very lower affinity. Glucokinase has higher affinity. Vmax of hexokinase is lower and glucokinase is higher. Who is induced by insulin? Glucokinase is induced by insulin. Feedback inhibition for hexokinase is glucose 6-phosphate. Please remember, for hexokinase which is there in peripheral tissues is glucose 6-phosphate. Whereas glucokinase ke liye, which is there in the liver, is fructose 6-phosphate. Amma. This is a garma turum point. Opposite. Glucokinase fructose 6-phosphate. Repu parikshalo. Tomorrow exam, when this comes, no, you will remember Murali Bharadwaj. Right? Then comes citric acid cycle. Fadafad. 1 hour में biochemistry हो जाना. Pyruvate to acetyl CoA produce 1 NADH and citric acid cycle produce 3 NADH, 1 FADH2, 2 CO2, 1 GTP per acetyl CoA, 10 ATP. And TCA cycle reaction occur in mitochondria. Citrate in Krebs, citrate in Krebs cycle is the starting substrate for making oxaloacetate. Alright, doc. Then comes essential fructosuria, hereditary fructose intolerance. Favorite question of the examiner. Essential fructosuria होता है fructokinase defect, autosomal recessive, fructokinase defect. So hexokinase become the primary pathway and it converts fructose to fructose 6-phosphate in this. And it causes milder symptoms. So you should remember, fructose become fructose 1-phosphate by fructokinase. And this fructose 1-phosphate typically will contribute to dihydroxyacetone phosphate and moves forward. So fundamentally, fructokinase is for fructose to fructose 1-phosphate. Fructose 1-phosphate will become this 2 by the action of aldolase B. So which is more severe? If fructokinase is not there, maximum fructose get accumulated. But the problem is if aldolase B is affected, then fructose 1-phosphate, which is already sequestered phosphate, which is very important for ATP formation, all phosphate is exhausted because of accumulation in the form of fructose 1-phosphate. So aldolase B is more dangerous than fructokinase deficiency is what you need to remember. So essential fructosuria means fructokinase deficiency, which is benign. Whereas aldolase B deficiency is hereditary fructokinase, fructose intolerance, which is more dangerous because phosphate, money, dollar wasted. So that's the favorite question of the examiner, doctor, between the two. What enzyme it is? Essential fructosuria, fructokinase. Hereditary fructose intolerance, aldolase B. Aldolase B is more dangerous. Hereditary, more dangerous. बाप ने पैसे दिए तो हम कुछ भी नहीं बनेंगे. अपने आप का पैसे कमाए तो कुछ कहानी बोलने के रहता है बच्चों को. Right? So that is very, very important. Same thing happens in galactose. Galactokinase deficiency, अगर आप लिए तो galactitol accumulates. Galactitol accumulates. So it presents like failure to track objects or develop social smile. So this is similar to benign essential fructosuria. There also fructokinase deficiency. Here galactokinase deficiency. That means galactose is not becoming gall phosphate.
Yes.
That's the reason phosphate is not sequestered. So it is benign galactokinase. Whereas the other one, classic galactosemia means GALT deficiency, which is galactose 1-phosphate uridyl transferase deficiency. Typically in this galactitol accumulates, cataract develops, hepatomegaly, jaundice, intellectual disability, everything satyanash ho gaya. So classic galactosemia is GALT deficiency, which is like hereditary fructose intolerance. Not essential fructosuria. Galactokinase deficiency is like essential fructosuria. Did I say reverse? No. GALT deficiency is classical galactosemia, which is more dangerous. Hereditary fructose intolerance also more dangerous because of the aldolase B deficiency. Whereas galactokinase deficiency and fructokinase deficiency are benign. That much you should know, doctor. Almost 45 online classmates. हम बहुत खुश हैं, right? So good to see Gauri, Shivanarayan, Nischal Krishna, Kamini, Sakore, Yudhishthar, Shubham, Vignesh. I'll be missing all of you in another couple of days when you crack the NEET PG. But still new students will start coming and once more life goes on. So now, doctor, amino acids. Remember, only lamino acids will be found, not damino acids in protein. No dominos, only laminos. Laminos will be found. Only LAV exists. Then PVT tinhol, phenylalanine, valine, tryptophan, threonine, isoleucine, methionine, histidine, leucine, lysine are all essential. What are glucogenic? Methionine, histidine, valine. Methionine, histidine, valine. So we met his Valentine. He's a mnemonic who is so sweet.
Yes, nice.
That is glucogenic. Glucogenic or ketogenic is isoleucine, phenylalanine, threonine, tryptophan. Don't remember it this way. You remember only glucogenic and you remember purely ketogenic. Purely ketogenic is leucine, lysine. The only purely ketogenic amino acids. Then acidic are aspartic acid, glutamic, negatively charged at body pH. Basic are arginine, histidine, lysine. Arginine is most basic. Histidine has no charge at body pH, hence it has got a buffering capacity because the pK value is equal to pH value of the plasma. pK means what? pK is the place where amino acid exists like a jitter ion. Jitter ion means neutral. Neutral. So that is the reason it has no charge at body pH. Arginine and histidine are required during periods of growth. So they are called semi-essential amino acids. Only during growth. Just like you require Murali Bharadwaj only during last 36 hours. So arginine and lysine are increased in histones which bind negatively charged DNA. So quickly, what is in histone? Arginine, lysine. What is in growth? Arginine, histidine. What is buffering? Histidine. Okay? And that's the point, doctor. One MCQ will come from this sheet. You need to be very much be ready. All right. So, good to see Rahul, Afroz, Sultana, and many more. So, doctor, please let me know, is the speed okay or am I too fast? Mithuna? Absolutely fine? Good. So now, let's talk about urea cycle quickly. First is carbamyl phosphate forms, then better see the picture. That's much easier. Okay. Breathe. CO2 plus NH3, carbamyl phosphate, you have carbamyl phosphate synthase 1. Ornithine transcarbamylase converts L-ornithine to citrulline by incorporating carbamyl phosphate. That become arginosuccinate by adding aspartate. So arginosuccinate synthase. That become arginine by leaving fumarate out. Aspartate in, fumarate out. Arginosuccinate lyase. L-arginine become L-ornithine and urea is released, which is called arginase. Always remember, if carbamyl phosphate synthase or ornithine carbamyl transferase, if these things are affected, ammonia become accumulated, hyperammonemia more severe. But if the later part enzymes are involved, it will be milder. That's the point you need to remember. So, aur ek baar, mere pyare Bharatvaasiyon, what are mitochondrial? Carbamyl phosphate synthase 1, ornithine transcarbamylase 1. These two are mitochondrial. You can remember coma. Carbamyl phosphate synthase 1, ornithine transcarbamylase 1 are there in mitochondria. So, three enzymes are mitochondrial. One more is there. A means N-acetyl glutamate synthase. Because here you require glutamate, no? N-acetyl glutamate comes and acts with ammonia and bicarb, no? Here. N-acetyl glutamate synthase also mitochondria. It's called NABs. I mean, N-acetyl glutamate will not add, it will stimulate carbamyl phosphate synthase 1. Activate. So this N-acetyl glutamate, which is the activator of the carbamyl phosphate synthase 1, is also mitochondrial. So remember, coma means carbamyl phosphate synthase 1, ornithine transcarbamylase. A for N-acetyl glutamate synthase 1, all of them, they form the coma. Then comes phenylketonuria. Don't tell me you don't know the enzyme. Phenylalanine hydroxylase is what you need to remember. Then maple syrup urine disease is what, doctor? Branched chain keto, alpha keto acid dehydrogenase, which require thymine. Then increased keto acids. Isoleucine, leucine and valine are called branched chain. This is also called maple syrup urine disease or burned syrup is what you need to remember. Now, doctor, alkaptonuria. Homogeneous oxidase is what you need to remember. Homogeneous oxidase. And this is how there is a deployment of homogenesic acid leading to ochranosis, intervertebral disc Calcification is seen in occlunosis. Black colored urine in occlunosis is what you need to remember. Now comes homocystinuria. Autosomal recessive. Cystathione synthase. Cystathione synthase. Jai Bolo Ganapati Maharaj ki Jai. Cystathione synthase. In this, what will be? Don't tell. Murali Bharadwaj, MD, General Medicine. Ajkal. I prepare for 8th class exam. My kid and his friends. हम सब ऐसे ही पढ़ते, सोशल स्टडीज को, साइंस को, ऐसे ही मजा आता है. Cystathione synthase typically has decreased affinity for pyridoxal phosphate in homocystinuria. So cystathione deficiency. So how do you treat increased pyridoxine? Pyridoxine de do baba. Pyridoxine de do. Homocystinuria normal ho jayega baba. Right? Is what you need to remember. So doctor, homocystinuria is different from one minute. Cystinosis, there's one more entity. But anyway, in homocystinuria, what do you have? High homocysteine, osteoporosis, marfanoid habitus, ocular changes. How will be lenticular subluxation? Downward, inward. Let us say this is the nose. Downward, inward. Marfan mein? Outward, upward. Outward, upward is marfan. लंबू है ना वो, इसलिए अपवर्ड जाएगा. लंबू को देखने के लिए तो क्या करना? आउटवर्ड देखना. So kyphosis, hypopigmented skin, is what you need to remember. This is different from cystinuria. Homocystinuria is different from cystinuria. Homocystinuria is gay because it is homo. Cystinuria is not gay. So this is not homo. Homo is different from regular. This is straight cystinuria. So it is a hereditary defect in renal proximal convoluted tubule. Cystinuria क्या पिएगा? कोला. Cysteine, ornithine, lysine, arginine. और एक बार बोलो. Cysteine, ornithine, lysine, arginine. Cysteine, ornithine, lysine, arginine. We are hysterical, right? Hallelujah. Make us the NEET PG toppers. Cysteine क्या होता है? Disulfide bond between two cysteine. And what will be the shape? Hexagonal. Urinary alkalinization should be done to treat it. Good hydration. Low in methionine. Low in methionine. Diet should be. And autosomal recessive. And what is the test to detect? Urinary sodium cyanide nitroprusside test. Urinary sodium cyanide nitroprusside test. For this hexagonal. Hexagonal is what you need to remember. अभी हम पहुंच गया है शिवनारायण. जय बोलो मुरली भरद्वाज सर की जय. Very good. So we will not remove the YouTube video then. जरा आप टीचर को भी जरा हिस्टोरिकल बनाना. ऐसे मजे में पढ़ना. वो मजे में पढ़ने के लिए रोते हुए दोस्तों के साथ नहीं बैठना. Psychotic friends like me you require, not mood levels में low mood नहीं, high mood, over high mood. हम ventilator में बैठने के लिए तैयार हैं. Somebody give me lithium. So now one guy. Favorite question, doctor? Okay question. Glycogen storage disorderలలో నుంచి రాకుండా సావదు. వాడు పరీక్షాధికారి छोड़ेगा नहीं. वन गाइड के डिसीज एग्जाम हॉल में बैठ के ये ग्लाइकोजन फॉस्फोरिलेज है क्या, ग्लूकोज फॉस्फोरिलेज है क्या, नहीं तो G6PD है क्या बोल के नहीं सोचना. आइंस्टीन के जैसे एक क्या डेफिशिएंसी है? ग्लूकोज 6 फॉस्फेटेस, नॉट G6PD, not glycogen phosphorylase. It is glucose 6 phosphatase is what you need to remember. Severe fasting hypoglycemia, glycogen becomes stored in liver and kidneys, increased triglycerides, Renomegaly, blood lactate is typically increased. Examiner will give all these clues. फिर भी आप वॉन देर को टिक नहीं मारे तो एग्जामिनर क्या कोचिंग लेता है पद्मनाभ नगर में भीड़ भीड़ बन के. So shortly we are starting a center. We are also joining the group Padmarao Nagar mein, but our fee will be very low. Our competitors will cry. हम तो 80,000 में जो नहीं मिल रहा है 20,000 में कैसे मिलेगा, 10,000 2,000 में कैसे मिलेगा. So doctor, that is what. Then comes Tay-Sachs. Already I gave a YouTube video on this. Hexasaminidase A, cherry red spot, ganglion cell layer accumulation, onion skin in lysosomes, no hepatosplenomegaly compared to Niemann-Pick में hepatosplenomegaly. Tay-Sachs में no hepatosplenomegaly. Tay-Sachs Y, hexosaminidase X. X is for Y is for X. एक दूसरे के लिए. So GM2 ganglioside accumulates and it is autosomal recessive. What is this, doctor? Cherry red spot, doctor, is what you need to remember. Then Fabry alpha. You can write like this. Fabry alpha for alpha ka alpha galactosidase ye. Episodic peripheral neuropathy, angiokeratomas, hypohidrosis, anhidrosis like Horner. Similar to that. But very important is what, doctor? X-linked recessive. X-linked recessive is Fabry. How do you remember? F is female. Who has got a alpha? Typically is X-linked recessive. Please remember.
Alpha and female both will produce a Fabry.
So Tay-Sachs is hexosaminidase. Fabry में alpha galactosidase A. Gaucher, G for Gaucher, आओ बेटा Gaucher, glucocerebrosidase. G for Gauri, G for glucocerebrosidase, G for Gaucher. Gauri, you are made immortal in this discussion. Then sphingomyelin becomes ceramide, Niemann-Pick. Niemann-Pick में what is involved? Galactocerebrosidase, sphingomyelinase. Krabby, galactocerebrosidase. Metachromatic leukodystrophy, aryl sulfatase ये. खाली ये रिमेंबर करने के लिए आपको 1 मार्क कल मिलेगा. Right? These are all, doctor, these are all the angiokeratomas which you see in Fabry. Which is X-linked recessive means it is found in boys, not in girls. Metachromatic leukodystrophy is aryl sulfatase A deficiency is what you need to remember. So Krabby क्या होता है? Galactocerebrosidase deficiency is Krabby. In this, what is important? Massive accumulation of globoid cells. Globoid. Krabby. Gaucher में क्या होता है? Avascular necrosis of femur होता है. Crumpled tissue paper appearance. Last NEET PG exam में, this was a favorite question. So you need to remember this stupid question. Glucocerebrosidase, which is also called beta glucosidase. Just like Fabry में क्या होता है? Alpha glucosidase. खत्म? बस उतना ही है, उससे ज्यादा नहीं है. घर पहुंच गए हम. Niemann-Pick, sphingomyelinase, foam cells, cherry red spot, right? Niemann-Pick में होता है hepatosplenomegaly. Tay-Sachs में नहीं होता. No hepatosplenomegaly. ये कैसे याद रखोगे? कल के नीट पीजी के लिए वही पूछेगा एग्जामिनर. Very good, doctor. Now, Hurler, alpha 1 L-iodinase deficiency. इसमें clouding रहता, corneal clouding रहता. Heparan sulfate, dermaton sulfate accumulate. So this is the Hurler. Right? And another thing, what do you see? A special type of vertebrae. Ribs. So special type of ribs will be found. Broad ribs they are called. Then hunter में क्या होता? Iduronate. Sorry, that means this is one, not I. Alpha 1 iduronate deficiency. One is Hurler. Hurler. L1. Then iduronate 2. 2 is T. Hunter. 2 is T. Hunter. This is LKG. T for 2, T for hunter. Hunter is iduronate 2 is what I remember. Understand, doctor? And what is the inheritance pattern? Hunter is X-linked because he hunts, all men hunt girls. So, whereas hurler is autosomal recessive. That is another point you need to remember. Over. No hunter, no hurler anymore. Now, doctor, ketone bodies. Hunting करने के लिए आंख दिखना चाहिए. Now comes ketone bodies. What are ketone bodies? Acetoacetate, beta hydroxybutyrate, right? And acetone, acetoacetate, beta hydroxybutyrate. And two important enzymes you need to remember, doctor. What are they? First of all, how does ketone body formation occur? 2-acetyl-CoA form, acetyl-CoA form, beta hydroxy methyl glutaryl CoA, from which once more acetoacetate forms and that divides into acetone and beta hydroxy butyrate. So first enzyme is called thiolase, which convert 2-acetyl-CoA into acetyl-CoA. HMG-CoA synthase lead to HMG-CoA. So both cholesterol and also for ketone body, HMG-CoA synthase is common. Synthase is common. But यहाँ क्या होता है? HMG-CoA lyase होता है. पहला HMG बनना पड़ेगा ना, HMG-CoA बनने के लिए synthase चाहिए, वो दोनों में रहता. मगर lyase होता है ketone bodies में, reductase होता है कोलेस्ट्रॉल में. और एक बार बोले बेटा, लाइएस होता है कीटोन बॉडी में, रिडक्टेस होता है कोलेस्ट्रॉल में. बस ये सूक्ष्म ज्ञान मिल गया तो आपको मिल जाएगा मोक्ष. नेक्स्ट, हाउ इज कीटोन बॉडी इज वंस मोर रीयूटिलाइज्ड इन पेरिफेरल टिश्यूज. कीटोन बॉडी अंदर जाएगा, फिर उसको कोए चाहिए, कोए काउंट देगा, सक्सिनल कोए ट्रांसफरेज देगा. But SCOT is there only in the tissue. SCOT is not there in the liver. Because liver, it is not there. It can't use ketone bodies. Liver can only synthesize ketone bodies. Only organ that can synthesize liver, ketone bodies, liver. Only organ that cannot utilize ketone bodies, liver. Once more. Understand? Allud notlo అడుక్కుతినే పరిస్థితి అంటే ఇదే. అన్నీ ఉన్నా శని అంటే it can only produce liver, it can't use liver. I mean, liver can't use ketone body, liver can only produce ketone body. Because SCOT is not there, is what you need to remember. Now, doctor, what is another thing? Utilization of this, where does it occur? Mitochondria में होता है. Ketone body oxidation is in mitochondria. RBC don't have mitochondria. That's the reason RBCs also cannot use ketone bodies. Clear? Now, doctor. Very good. 55 online. I am waiting how this can become 100. Oh my God. 57 minutes over. We need to finish very fast. Now, doctor. What are key enzymes in liver transport? This is lipid transport. Favorite question, doctor. जो ये पढ़ा है, अभी सुना है, 1 मार्क का आएगा. One is CETP, cholesterol ester transfer protein. It mediates the transfer of cholesterol esters into the lipoprotein particles. चॉकलेट को ले जाके चॉकलेट पैकेट में बिठाएगा. There is one hepatic lipase, hormone sensitive lipase, pancreatic lipase, lipoprotein lipase. 4 lipases बोलो बेटा. Hepatic lipase, pancreatic lipase, hormone sensitive lipase, lipoprotein lipase. फटाफट बोलो क्या क्या करेगा ये सब चीजें. 4 lipases है. They degrade the triglycerides in the ideal and chylomicron remnants. Ideal forms from VLDL. Ideal forms VLDL. So VLDL जो होता है ना, principal carrier of endogenous triglyceride. और एक बार बोलो, principal carrier of endogenous triglyceride. Chylomicron is a carrier of exogenous triglyceride. बाहर चिकन, मटन, हलीम वो सबसे मिलने वाला ट्राइग्लिसराइड कहाँ होता है? खाइलोमाइक्रोन में. जो लिवर तैयार करता है ट्राइग्लिसराइड, VLDL में. सो ट्राइग्लिसराइड रिमेनिंग इन द आइडियल एंड खाइलोमाइक्रोन रेमनेंट. VLDL बनेगा आइडियल, खाइलोमाइक्रोन बनेगा खाइलोमाइक्रोन रेमनेंट. इसमें फिर भी थोड़ा ट्राइग्लिसराइड रह गया, उसको निकालने के लिए कौन है? हेपेटिक लाइपेज. So hepatic lipase is like a barber for a bald head client. Already वो bald है, थोड़ा पीछे hair है, उसको shaving करने के लिए कौन बैठा है? Hepatic lipase. Do you remember? Then hormone sensitive lipase. So all hormones, insulin is lipogenic, glucagon, epinephrine, growth hormone, lipolytic, growth hormone, insulin, epinephrine, lipolytic, and all that hormones act on hormone sensitive lipase. They degrade the triglycerides which is there in our adipose tissue. मोटा दुबला हो जाएगा जब डायबिटीज होगा और इंसुलिन नहीं है. It promotes gluconeogenesis by releasing glycerol. Then lipoprotein lipase क्या करेगा? It degrades the triglycerides in the circulating chylomicrons and VLDL. Chylomicron remnant बन गया, VLDL ideal बन गया. Then hepatic lipase. But before that, lipoprotein lipase degrades. Then what is pancreatic lipase? Small intestine में directly, because it is produced through the ample of water into the duodenum, and there it will degrade the triglycerides which you have eaten before they got incorporated into chylomicron. और एक बार बोलो फटाफट. ఎందుకు మళ్ళీ ఇప్పుడు చదివింది నుంచి మొదలు పెట్టదు, మొదటి నుంచి మొదలు పెట్టు. अच्छा इక్కడి నుంచి మొదలు పెడదాం. ఓకే. సో खाते ही पैनक्रियाटिक लाइपेज ब्रेक करेगा. सो काइलोमाइक्रोन VLDL से ट्राइग्लिसराइड निकालने वाला लाइपोप्रोटीन लाइपेज. बाद में वेरी गुड. थाइरोमाइक्रोन रेमनेंट एंड आइडियल से ट्राइग्लिसराइड को कौन निकालेगा? हेपेटिक लाइपेज. पूरा टिश्यू से ट्राइग्लिसराइड को निकालना बोले तो, ब्रेक करना बोले तो हार्मोन सेंसिटिव लाइपेज. क्लियर? one MCQ going to come. Then Dr. LCAT, lecithin cholesterol acyl transferase. It esterifies 2/3 of plasma cholesterol. It esterifies. That means it will convert cholesterol into cholesterol ester. That's good. Because इसको कोलेस्ट्रॉल एस्टर बना के, मिस को मिसेस बना के, मिस्टर को मिस्टर बना के, उसको ले जाके काटने के लिए लेके जाएगा HDL. So that is LCAT and HDL maturation. Then PISC9. What is PISC9? It degrades LDL receptor. It increases serum LDL. So you use PISC inhibition. If you inhibit pisking, then what will happen? Good for health. It will increase the LDL receptor recycling and decrease the serum LDL. That's the reason PISC 9 inhibitors are good hypolipidemic drugs is what you need to understand. So, doctor, now comes apolipoprotein. Huh? వస్తాం దానికి కూడా టైం వచ్చేస్తుంది. So Nischal is reconfirming HMG CoA synthase is present in both ketogenesis cholesterol synthesis, but reductase is there in HMG CoA reductase in cholesterol and lyase in ketogenesis. ఏం అర్థం చేసుకున్నావు కాక? నిశ్చల్ టాపర్ అయినాక నాకు లడ్డు పంపియప్ప. Now now, doctor, apolipoproteins, you should know apolipoprotein E mediates the remnant uptake. Remnant uptake except LDL. Everything except LDL. Then apolipoprotein A1, it is found only in HDL. It activates LCAT. Then apolipoprotein B48. B48 is in chylomicron secretion into lymphatics. Apolipoprotein B100, it binds with LDL receptor. They are the main things you need to remember. So quickly tell me, doctor, what are the lipoprotein functions? LDL, HDL has most of the cholesterol. Chylomicron, dietary triglycerides. Then VLDL is endogenous triglycerides, that is hepatic triglycerides sent to peripheral tissue. IDL delivers triglycerides cholesterol to the liver, formed by the degradation of VLDL. Then LDL delivers hepatic cholesterol to peripheral tissues. Just like VLDL delivers hepatic triglycerides to peripheral tissues. So, ఈ B48 యాడ్ ఉంటుంది, B100 యాడ్ ఉంటుంది, ApoE యాడ్ ఉంటుంది, ApoA1 యాడ్ ఉంటుంది. అదైతే మర్చిపోయినట్టే కథమే తమాషా చేసిస్తాడు ఎగ్జామినర్. కేలేగా हमारे जिंदगी से కేలేగా ఎగ్జామినర్ if you don't remember. All right, anyway, all of that is there in notes, doctor. Please kindly review it once more. Okay. Now, doctor. Now, quickly, few hyperlipoproteinemia. Abetalipoproteinemia, it is autosomal recessive. MTP, you need to remember. Microsomal transfer protein mutation in this gene lead to that. Chylomicrons, VLDL, LDL are absent in them. Deficiency in ApoB48 and ApoB100 containing lipoproteins will be there. B48 कहाँ होता बेटा और B100 कहाँ होता? B100 LDL and B48 is chylomicron. ठीक है? हाँ. So containing lipoprotein. Severe fat malabsorption, steatorrhea, failure to thrive. Remember, abetalipoproteinemia, retinitis pigmentosa, spinocerebellar degeneration, progressive ataxia, acanthosis, cytosis, and treat with giving vitamin E. And enterocytes will be lipid laden. ఈ 6-7 ముక్కలు జర ముక్కలు పెట్టుకుని చీది రావాలి. క్లియర్? और एक बार बोलो गणेश महाराज की जय. Microsomal transfer protein, VLDL, LDL absent, ApoB48 and ApoB100 affected, severe fat malabsorption, retinitis pigmentosa, spinocerebellar degeneration, vitamin E deficiency, progressive ataxia, acanthosis, cytosis, and oral vitamin E is the therapy, is what you need to. These are the acanthocytes. These are the lipid-laden cells in the enterocytes. Next comes a favorite question. What is that, doctor? Familial dyslipidemias. Type 1. hyperchylomicronemia. We always remember from intestine now. So one is chylomicron, autosomal recessive. And it is due to lipoprotein lipase or ApoC2 deficiency. ApoC2, C for ApoC2, chylomicronemia is what you need to remember. Similarly, lipoprotein lipase deficiency or ApoC2 deficiency lead to type 1. Good to do that? Increased chylomicrons, increased triglycerides, even increased cholesterol, pancreatitis, hepatosplenomegaly, eruptive xanthomas, creamy layer in the superintendent when you do centrifugation of the blood. Type 1. Khatam? Remember? One question aayega. Sure. Last final call. Gates of the Indigo flight are getting closed. कोई जा रहे हैं क्या दिल्ली को? जल्दी आओ. So type 2 hypercholesterolemia. One is chylomicronemia, 2 is hypercholesterolemia. It is autosomal dominant, unlike type 1 is autosomal recessive. Absent or defective LDL receptors, defective ApoB100, any of them. 2A, 2B. 2A means increased LDL, increased cholesterol. 2B means increased LDL, increased cholesterol, increased VLDL also. 2B में क्या रहता है additionally? Triglycerides are also affected. 2B में. Because VLDL also is increased. Here only LDL and cholesterol are increased in 2A. So 2A is because of LDL receptors are defective ApoB100. Heterozygotes have cholesterol 300, homozygotes have more than 700. Accelerated atherosclerosis, MI before 20 years. Tendon xanthomas, corneal arcus. Then there is a type 3 dysbeta lipoproteinemia. This is also autosomal recessive. ApoE is defective. You can remember type 3 is ApoE. E is important for chylomicrons and VLDL. They also have xanthomas, premature atherosclerosis. Type 4 hypertriglyceridemia. It is autosomal dominant. Hepatic overproduction of VLDL, increased VLDL, increased triglyceride. Hypertriglyceridemia is more than 1000. It can lead to acute pancreatitis and related insulin resistance is type 4. So, superintendent showing chylomicronemia, type 1. Arcus senilis, type 2. 2 na mana? 2. మళ్ళీ నువ్వు 2 అని ఇట్లా అంటావు 2 అనాలి 2 ఇట్లా కాదు ఇదేంటి ఇరప్టివ్ xanthomas ఇవి టెండాన్ xanthomas అండర్స్టాండ్ డాక్టర్ ఇటాలియా మళ్ళా ఇన్హెరిటెన్స్ ప్యాటర్న్ మర్చిపోదు బిడ్డ 1 is AR 2 is so 1 and 3 is AR 1 and 3 AR 2 and 4 AD. గుర్తుందా?
Most of the things are autosomal recessive and biodistributed. There are few other things happening. అది లిస్ట్ చేస్తాను కదా.
నేను టాపర్ అక్క. ఇదో పెట్టుకోలే ఉంటా. Now doctor next. Pyrimidine purine. फटाफट बोले तो we can conclude biochemistry more or less. DNA polymerase లు అవి కొన్ని ఉన్నాయి. భయపడకండి చెప్తా. Then de novo pyrimidine based production. So how is pyrimidine produced?
Sir,
Directly let us go. एक चीज है इसमें DNA की प्रोडक्शन pyrimidine के प्रोडक्शन में कौन कौन कंट्रीब्यूटर है? Aspartate, glutamine provide nitrogen, carbamyl phosphate provide carbon, glucose forms phosphoribosyl which provide the nitrogen part. So now doctor let us quickly go. Carbamyl phosphate synthase 2 is there. Okay, quickly ये देख लो. फर्स्ट क्या बनेगा? ATP plus ribose 5 phosphate forms PRPP, phosphoribosyl pyrophosphate, and that in turn will affect the carbamyl phosphate synthase 2, which convert ATP plus carbon dioxide plus glutamine into carbamyl phosphate, that typically become dihydroorotate, that become orotic acid. This happens inside mitochondria. From that, OMP become UMP, UDP, UTP, CTP, DUDP, dump, temp, TDP. Understand?
Yes.
So this step where UMP synthase, this is called as,
Yes.
which convert OMP to UMP. If that is inhibited, that lead to too much orotic acid, which is called orotic aciduria, which is because of UMP synthase 1 deficiency. Understand, Doctor Italia?
Yes, sir.
हाँ. Then और एक बात क्या याद रखना आप,
Drugs affecting
ADP, GDP, CDP, UDP all become DADP, DDGP, DUDP by the action of ribonucleotide reductase. And how does your hydroxyurea work? Anti-cancer drug, it inhibits ribonucleotide reductase inhibitor is what you need to remember.
hence, okay, that's why DNA and RNA is not.
So this is one favorite MCQ in exam, doctor. What is that? Once more, fatafat bolo. Glutamine plus carbon dioxide give carbamyl phosphate, for which carbamyl phosphate synthase 2 is involved. Carbamyl phosphate plus aspartate form orotic acid plus PRPP form UMP, for which you require UMP synthase. UMP synthase is impaired in orotic aciduria congenitally, whereas carbamyl phosphate plus aspartate become orotic acid. That is inhibited by leflunomide, which is used in rheumatoid arthritis as an anti-inflammatory. Because if there is no orotic acid, no pyrimidine, no DNA, no inflammatory cells can multiply. That is the reason you will try to use it as an immunosuppressant. Leflunomide, और एक बार बोलो बेटे, leflunomide. Good. This is called as ecolalia. Then UMP become UDP, UDP become CTP, UDP become DUDP. Any UDP, ADP, TDP, any PDP become DUDP. That is ribonucleotide reductase, which is inhibited by hydroxyurea. Then DUDP become dump become temp. Dump को temp बनाने वाला कौन होता है? Ribonucleotide reductase होता है. And that is also inhibited by 5-fluorouracil and capecitabine. Then N5-N10 dump become methylene tetrahydrofolate, which become, methylene tetrahydrofolate become dihydrofolate become tetrahydrofolate, for which dihydrofolate reductase is required, which is inhibited by methotrexate, famotoprim and pyrimethamine. One MCQ जरूर आएगा. क्या आएगा? Carbamyl phosphate synthase 2 is the rate limiting enzyme in pyrimidine biosynthesis. It is inhibited by, it is then carbamyl phosphate plus aspartate leading to orotic acid, that is inhibited by leflunomide. Then UMP synthase is deficient in orotic aciduria. Ribonucleotide reductase is inhibited by hydroxyurea. Dump to temp is inhibited by 5-fluorouracil and capecitabine. Dihydrofolate reductase is inhibited by methotrexate, trimethoprim and pyrimethamine is what you need to remember. Bas. Gurtunte danadrishtam, marchipote manadrishtam. Right? So don't worry at all. Right? Go easy. Breathe. Go easy. Now, doctor. Purine. What do you require for purine base if you are doing it de novo, or you can reuse? Either you can live in your own villa or you can rent it. So de novo के लिए क्या चाहिए? Bricks चाहिए, permission चाहिए municipality का बनाने के लिए. Aspartate, glycine, glutamine and tetrahydrofolate. What is needed? Aspartate, glycine, glutamine and tetrahydrofolate. जो फोलेट हम पत्ते से खाते ना, वो जाके हमारे डीएनए बना के हमको नीट पीजी टॉपर बनाएगा. सो नीट पीजी टॉपर बनाने के लिए पत्ते का खाना पड़ेगा. ठीक है. हाँ, तो green leafy vegetables will make you the NEET PG topper because they provide tetrahydrofolate required for purine base, which require DNA required for thinking in NEET PG exam. Okay, then ribose 5-phosphate become PRPP become IMP. This is the favorite question. First purine to form in the purine synthesis, IMP. So ribose 5-phosphate to PRPP to IMP है ना, ये step को कौन रुकेगा? 6-mercaptopurine and azathioprine. IMP become AMP, IMP can become GMP. जब IMP GMP बनने का कोशिश करे तो कौन रुकेगा? Ribavirin, which is used to treat HCV, mycophenolate mofetil, which is used as an immunosuppressant. How do they act? IMP to GMP, IMP to GMP. Stop करेगा mycophenolate mofetil and ribavirin is what you need to remember. This is all pure cocaine, doctor, pure cocaine, right? Just unloaded from Africa. Clear? Now, what drugs affect pyrimidine synthesis? Leflunomide. Which drug, which enzyme? Dihydroorotate dehydrogenase. 5-fluorouracil and its prodrug capecitabine form 5 dump and inhibit thymidylate synthase. Thymidylate synthase. Clear? Now, what drugs affect the purine synthesis? 6-mercaptopurine and azathioprine inhibit de novo purine synthesis. Azathioprine is metabolized by once more xanthine oxidase. So, if you happen to give allopurinol like drugs, be careful because azathioprine is no more metabolized and its level can increase. So, you need to decrease the dosage of azathioprine. By chance, if you are also giving allopurinol. You will put no. Then okay nahi puta. Aithe orthopedics पंपिंचे. Okay. ये होने के बाद ortho reverse करेंगे. गर्मा गरम. Mycophenolate and ribavirin inhibit inosine monophosphate dehydrogenase. Now, what are the drugs affecting? Because why I am emphasizing so much is, remember this 133 point paragraph, 132 paragraph, just before going to exam, na? Just before you go to exam, just before going into the first night nuptial night room, granny ma will call the grandson. देखो बेटा लड़की को कैसे पकड़ना, जरा कैसे डेलिकेट रहना, वो सब YouTube में नहीं मिलता, मैं बोलता हूँ बोल के वो उनको एजुकेट करेगा. वैसे लास्ट मिनट बिफोर यू गो टू एग्जाम ना एक बार देख लो ये पैराग्राफ 132 पैराग्राफ 133. ठीक है. So in the notes, 1200 pages notes I have given to you. Now doctor, now hydroxyurea inhibits ribonucleotide reductase. Methotrexate, trimethoprim, pyrimethamine inhibit dihydrofolate reductase. Protozoa has pyrimethamine, bacteria trimethoprim, humans have methotrexate. I mean, where is this dihydrofolate reductase located, which is inhibited? Agreed, doc? Then once more, CPS1 is in mitochondria. Mitochondria, urea cycle found in liver and kidney. CPS2 is cytosol because it is 2. Pyrimidine synthesis found in most of the cells. Then adenosine deaminase. It is basically required for degradation of adenosine to deoxyadenosine. Decreased ADA lead to increased deoxy ATP. That will decrease the ribonucleotide reductase activity, that decrease the DNA precursors and decrease the lymphocytes and decrease immunity. That is what happens in SCID. Severe combined immunodeficiency is due to the deficiency of adenosine deaminase. So please remember, adenosine deaminase, where does it come? Adenosine become inosine. Deoxyadenosine become deoxyinosine. Then So that affects the DNA precursor formation and decrease the ribonucleotide reductase activity. Because what does ribonucleotide reductase does? It converts the things into deoxyform. Already it led to increased ATP. So that high DATP will go and inhibit the ribonucleotide reductase, and other purines and pyrimidines cannot be, their deoxyforms cannot be produced. If they are not there, DNA cannot form. Clear? Then comes our favorite Lesch-Nyhan syndrome. Defective purine salvage due to absent HGPRT, hypoxanthine to IMP gone into GMP cannot occur. Sodium urate crystals, sand diaper, and what is things in HGPRT? Hyperglycemia, gout, aggression, self-mutilation, red orange crystals, and dystonia. How do you treat allopurinol and febuxostat? Because they have hyperuricemia, is what you need to remember. So, doctor, comes genetic code. One MCQ invariably comes, right? Genetic code. Unambiguous. Each codon specifies only one amino acid. Degenerate. Most amino acids are coded by multiple codons. Woobl. What differs in the third position may code for the same tRNA or amino acid. So you don't read pediatrics, you don't read dermatology, you don't read anesthesia, फर्क नहीं पड़ता. Mainly क्या रहना? Medicine, surgery, gynops, गर्मा गर्म रहे तो seat आएगा. Specific base pairing is usually required only in the first two nucleotides. Then it is commaless, non-overlapping, fixed starting point. It is universal. Amoeba ho ya राजा हो, अमीर हो, नहीं तो गरीब हो या लुक्खे हो, सब लोग मरने के बाद एक ही जगह पे जाता है, right? So exception in human is mitochondria में it is not universal. Okay, doctor. Then topoisomerases is the favorite topic. Topoisomerase 1 and 2. So it is single or double. Standard break in a helix to add or remove the supercoils, you have topoisomerases. Irinotecan, topotecan, they inhibit 1. Etoposide, teniposide, 2. Fluoroquinolones inhibit 2. DNA gyrase, and 4. Top 4. Please remember one MCQ straight इसमें से आएगा. आपको याद रखना है etoposide, teniposide. Both sides. So 2. Irinotecan, topotecan. एक टोपी है. Irinotecan, topotecan, top 1. Fluoroquinolones top 2 and top 4. Alright, then what is primase? When the DNA polymerase 3 initiate replication, it required one RNA primer which is formed by primase. Then comes DNA polymerase 3. One question, doctor, question bank of examiner में एक question बैठा हुआ है. So DNA polymerase 3, it is seen in prokaryotes only. It adds deoxynucleotides in 3N. मतलब अमीबा में होता है 3. It elongates the lagging strand. It has 5'3" synthesis and proofreading with 3'5" exonuclease. And the drugs blocking DNA replication often have a modified 3OH, thereby preventing addition of the next nucleotide and lead to chain termination. Then DNA polymerase 1, prokaryotes only. It degrades the RNA primer, replace it with DNA. Same function as DNA polymerase 3. It also excises even RNA primer. That is an additional thing about DNA polymerase 3. So 1 and 3 which are there in prokaryotes, please don't forget, doctor. Favorite question of the examiner. RNA polymerases. They are present in eukaryotes. You have RNA polymerase 1. It is called rampant type. RNA बोल रहा हूं मैं. Nucleolus में रहता. 2 makes mRNA, massive RNA, and also microRNA and small nuclear RNA. mRNA, microRNA, small nuclear RNA, ये सबको बनाने वाला कौन होता है? 2. 1 क्या होता है? rRNA, rampant RNA, ribosomal RNA को 1 बनाता है. RNA polymerase 2 opens DNA at the promoter site. RNA polymerase 3, 1, 2 is over 3. It makes the 5S rRNA and tiny RNA is formed by 3. 3 formed by 3. 3 forms tRNA. T for tRNA. tRNA. So tomorrow exam favorite question. RNA polymerase 1, 2, 3 के difference क्या है? RNA polymerase 1 makes rRNA, rampant RNA present in nucleolus. 2 is makes mRNA, microRNA, small nuclear RNA, opens the DNA at promoter site. RNA polymerase 3, T form tRNA. No proofreading function but can initiate the change. Right? So 1, 2, 3 are MT. rRNA, mRNA, tRNA. Right? This is Chana Gyan. Then RNA polymerase like this only. Last moment revision means भाई देखा बोले तो देखा, लास्ट मोमेंट का देखना है ना, इसलिए देख रहा हूं बस. फिर भी नहीं याद आए तो उसका प्रॉब्लम है, मेरा नहीं. सो अल्फा एमांटिन inhibits RNA polymerase 2. Dactinomycin inhibits RNA polymerase in both prokaryotes and eukaryotes. Rifamycin inhibits DNA dependent RNA polymerase in prokaryotes. ఇది గుర్తుపెట్టుకోండి, డాక్టర్ ఒక క్వశ్చన్ అడుగుతాడు. జల్దీ ఫటాఫట్ బోలో. tRNA structure 75 to 90 nucleotides. CCA is there at the 3 end. Amino acid binds to 3 end. CCA can carry amino acid because amino acid binds to 3 end. 3 end ఉంటుంది కదా, ఈ 3 end దగ్గర CCA ఉంటుంది. ఇక్కడ CCA ఇక్కడ వచ్చి amino acid వచ్చి కూర్చుంటుంది. TRM is ribothiamidine pseudouridine cytidine sequence. It is necessary for tRNA राइबोसोम को जाके वो चुम्मा देना चाहिए ना, वो होता है द TRM. Okay, TRM. Then you have a D loop. Then you have the 5 end. So TRM tethers tRNA molecule to ribosome. Then DRM has D loop. So what does D loop has? Dihydrouridine residues which are necessary for tRNA recognition by the correct amino acyl tRNA synthase. DRM follows detection of tRNA by amino acyl tRNA synthase. So attachment site is 3. ACC5 is the amino acid acceptor site. This one. Acceptor site. So you can remember acceptor. Now amino acid aake baithega na. So 3 end mein ACC will cause acceptor is what you need to remember. Finish. Isse jada jaan ki khatra. Now doctor, start and stop codons. mRNA start codon AUG. AUG inaugurates protein synthesis. AUG. And the same AUG codes for methionine in eukaryotes and prokaryotes में N-formyl methionine. And this M-formyl methionine stimulates the neutrophil chemotaxis. कोई ऑर्गेनिज्म आ गया तो उसको देखेगा, पकड़ेगा, अरे रेगुलरली AUG जाके मिथ्योनिन को बनाना है ना, अरे ये फालतू आके N-formyl methionine है, अच्छा दैट मींस कोई बैक्टीरिया अंदर आ गया बोल के न्यूट्रोफिल्स भागते हुए आएगा, बराबर. Then mRNA, what are the stop codons? You go away, you are away, you are gone from my life. UGA, UAA, UAG, they're all the stop codons. Collagen. Type 1 to 4 are the most common types. Type 1 in skeleton, type 2 in cartilage, type 3 in arteries, type 4 is basement. So remember SCAP. Skeleton, cartilage, arteries and basement is what you need to remember. Chalo. 1-2 points about each of the collagens ko padenge hum. Let us wrap the preparation. Most common, type 1. Bone, tendon. में वोन होता है. Type 2 cartilage, it is there in cartilage, vitreous body, nucleus pulposus. Type 3 reticulin, skin, blood vessels, uterus, fetal tissue, early wound repair. Type 3 is deficient in Ehlers-Danlos, 3D. Then type 4 basement membrane, right? 4 is floor. Floor होता है basement. So basement membrane में type 4. So typically glomerulus cochlear lens. And it is defective in Alport syndrome. We have lenticonus, kidney involvement, sensory neural deafness, everything. And similarly, autoantibodies in good pasture are basically attacking type 4. Myofibroblasts are the ones which typically produce collagen, is what you need to remember. अभी आ गया uniparental disomy. Prader-Willi, Angelman. Prader-Willi is maternally derived genes are silenced. Papa, Prader-Willi. Chromosome 15 of paternal origin is involved. 25% cases are due to maternal uniparental disomy. अगर uniparental disomy क्या है बोले तो maternal होता है. What is silenced? Maternal genes. But it is the chromosome 15 of the paternal origin is involved. So P, Papa is Prader-Willi. So hyperphagia, obesity, intellectual disability, hypogonadism, hypotonia, they're all Prader-Willi. So you can remember POP, Prader-Willi, obesity, overeating, paternal allele deleted. Understand? Paternal allele deleted, maternal allele silenced. And it is maternal uniparental disomy. Maternal uniparental disomy, but 25% of cases only. So better you remember paternal origin is involved, paternal allele is deleted, paternal is Prader-Willi. Bas. Okay, so then this is what doctor, obesity, hypotonia, Prader-Willi mein. Obesity, typical facial features in Prader-Willi. Understand? Prader-Willi. Obese is Prader-Willi. POPs. Prader-Willi, obesity, paternal silenced. Paternal deleted. Maternal silenced. So now Dr. Angelman, paternally derived UBE3A is silenced. Papa silent, Mama mar gaya. Maternal allele is deleted or mutated. Mama mar gaya, Papa silent. दूसरे को शादी कर लिया. And what is Angelman? What is Prader-Willi? पैटर्नल पप्पा मर गया, मैटर मम्मा साइलेंट हो गया, अमेरिका जाके किसी को शादी कर लिया, मैं तो यहाँ भीख मांग रहा हूँ. Now, seizures, ataxia, severe intellectual disability, inappropriate laughter. UBE3A on the maternal copy of the chromosome 15 is involved. And 5% it is paternal uniparental disomy, but otherwise it is mother which is silenced. Mamas, maternal allele deleted, Angelman syndrome, mood ataxia and seizures. Bas. ఇంతకంటే దీని గురించి ఆలోచించడం వేస్ట్ దండుగా. అమ్మా వచ్చిందండి ఇన్హెరిటెన్స్ ప్యాటర్న్ వచ్చిందండి. ఒక క్వశ్చన్ వస్తుంది, ఒక క్వశ్చన్ వచ్చి తీరుతుంది.
all the enzyme deficiency we have read. Only two enzymes are autosomal dominance. Type 2 high familial dyslipidemia is autosomal type dominant. Type 2 is also autosomal.
2 and 4.
And others are all autosomal recessive.
All rate limiting biochemical enzyme deficiencies are autosomal recessive, early to appear, consanguinity associated, jaldi मृत्यु आ जाता है.
Only X-linked recessive disorders are Leishman, Hunter's, 6GT, Fabry's, adrenoleukodystrophy, 5.
Correct.
X-linked recessive.
Autosomal dominant is all structural genes. Many generations, both males and females are many generations. Autosomal dominant. दादा परदादों से आने वाला होता है autosomal dominant. Often pleiotropic, multiple apparently unrelated effects. 5 grandchildren, 1 doctor, 1 police, 1 thief, 1 terrorist. So pleiotropic and variably expressive. All of them, दादा परदादा ने एक ही दिया. मगर Rahul Gandhi different from Rajiv Gandhi, different from Gandhi. No, Gandhi is not involved. Nehru is different from Indira Gandhi. So variably expressive. Family history crucial in diagnosis. Congress party autosomal dominant. With one affected parent only, each child has 50% of chances being affected. Even if Sonia Gandhi is there also, Rahul Gandhi remains. Examples. Achondroplasia, autosomal dominant polycystic kidney disease, familial endometriosis, polyposis, familial hypercholesterolemia, hereditary hemorrhagic telangiectasia, hereditary cirrhosis, Huntington's, Life-Romney, Marfan, MENs, myotonic muscular dystrophy, neurofibromatosis, type 1 and 2, tuberous sclerosis, and von Hippel-Lindau. और एक बार देखो डॉक्टर, ऑटोसोमल डोमिनेंट में क्या दिखता है आपको?
Autosomal dominant 50%
50% involved. Super. Then
autosomal recessive.
why this cannot be autosomal dominant? Because when unaffected parents है तो एक affected child बनना कहाँ होता है?
It is a recessive.
See, sorry, unaffected child when cannot be dominant because unaffected parents could not have a affected offspring if it is autosomal dominant. Hence it is recessive. ये unaffected है, फिर भी
child is बीमार.
So it is autosomal recessive. Cannot, why this cannot be recessive?
Because the affected child is also affected.
Unaffected offspring.
Unaffected offspring.
बोथ डॉक्टर पेरेंट्स को एक 10th फेल होना असंभव है ऑटोसोमल रिसेसिव है तो ऑटोसोमल डोमिनेंट में भी हो सकता है. ऑटो ड्राइवर और बस कंडक्टर के बेटे डॉक्टर बनना खाली ऑटोसोमल रिसेसिव में होता है, डोमिनेंट में नहीं होता. ठीक है बेटा? Otherwise, another thing you can remember. This is what first generation entrepreneur. This is previous generations already है ना. दादा परदादों में जो होता है वो ऑटोसोमल डोमिनेंट होता है. किसी भी में नहीं है. मम्मी ओके, डैडी ओके, बट मामा को देखो, मामा में हो सकता. That is autosomal recessive. ठीक है? Then X-linked dominant. Only boys are affected. No, sorry, X-linked recessive. Only boys are affected. X-linked dominant, only girls are affected. Clear? Right? Then autosomal recessive. Each child has 25% chances of being affected, 50% chance of being a carrier, 25% not being affected nor carrier. Often enzyme deficiency usually seen only in one generation. नरेंद्र मोदी का बेटा मोदी नहीं बन सकता, उनका अब्बा भी मोदी नहीं है. That is autosomal recessive है. मोदी जी, गांधी family is autosomal dominant है. Nehru family commonly more severe than dominant. Ammo, Modi is more severe and most often present in childhood only. हाँ, चाय बनाने वाला प्राइम मिनिस्टर बन सकता है क्योंकि चाइल्डहुड से ही टैलेंट दिखता है. Increased risk in consanguineous families. Easy to remember. गुजरात में बड़ा फैमिली मोदी जी इसका. So consanguinity, मामा के डॉटर किसी और गर्ल इज नॉट लविंग मीन्स डोंट गो एंड मैरी. mama's daughter. Unaffected individual with affected sibling has 2/3 probability of being a carrier. Of course, pedigree dale to aayega. Quickly tell me what are the conditions? Oculocutaneous albinism, phenylketonuria, any enzyme deficiency, cystic fibrosis, sickle cell disease, Wilson's disease, sphingolipidosis, except Fabry, which is X-linked. X-linked recessive. Hemochromatosis, glycogen storage disorders, all glycogen storage disorders. Thalassemia, mucopolysaccharidosis, except Hunter. Hunter is X-linked. Friedreich's ataxia, Carter-Jensen, ARPKD is what you need to remember. So, usually appears equal in male and female, tend to skip generations. There is nothing in the daddy, great daddy, but next generation may aa sakta. X-linked sons are affected. More severe in males. Then Bruton-Sakama, globulinemia, both Duchenne and Becker, both of them are X-linked recessive. మీరు బై మిస్టేక్ డుకీన్ X-linked కదా, బెకర్ కాదేమో అనుకుని పెట్టారనుకోండి, ఎగిరిపోతారు. మా గుంటూరు ఆంధ్ర మెడికల్ కాలేజ్ అలా పెట్టమండి, వీరు X అయితే వారు కూడా X అవుతారండి. సో హిమోఫిలియా A and B, హంటర్ సిండ్రోమ్, లష్కరీ ఖాన్, HGPRT, ocular albinism, ornithine transcarbamylase deficiency also. Oh my God. Ornithine transcarbamylase also. Wiskott-Aldrich. Female with Turner syndrome are most likely to have X-linked recessive disorder. X-linked dominant, 100% of daughters and 0% of the sons are affected. उनके पास X हिच नहीं है, X है.
X है sir, but then
affected father से नहीं आता sir X.
Affected father is normal.
Father is affected, father gives X to daughters.
0% of sons of affected fathers will be affected.
Mothers are affected, sir.
Father made a daughter by giving his X chromosome, so if he is affected means his X is abnormal, that is given to the daughter. And son ko father won't give any X chromosome, it only gives Y. So X-linked dominant ho, recessive ho, kuch bhi ho. Finish. Then Fragile X syndrome, Alport syndrome, hypophosphatemic rickets, they are all X-linked dominant. One question aayega, doubt each nahi hai. Now doctor, cystic fibrosis, autosomal recessive, CFTR gene, it is there on chromosome 7. Cystic fibrosis. Cystic fibrosis 7. Most common lethal genetic disease in Europe. It encodes chloride channel. Phenyl PHE 508 deletion lead to misfolded protein. That improper protein become retained in rough endoplasmic reticulum, and that lead to decreased chloride secretion, increased intracellular chloride, that cause increased sodium reabsorption through the epithelial sodium channels, that lead to increased water reabsorption, that lead to thick mucosa, that affects meconium in GI and in lungs get blocked. Then increased sodium reabsorption cause more transepithelial potential difference, increased chloride concentration in pilocarpine-induced sweat test. So remember pilocarpine-induced sweat test. Salty baby, if the mother is a Dracula. Then increased immunoreactive trypsinogen is the laboratory diagnosis. Ante. Then complications kya hota? Staph aureus, Pseudomonas aeruginosa, bronchopulmonary aspergillosis, nasal polyps, nail clubbing, pancreatic insufficiency, meconium ileus, infertility in males, subfertility in females, in cystic fibrosis. How do you treat? Dornase alpha, which is dinase. Ibuprofen, azithromycin, pancreatic enzyme replacement, lumacaftor, tezacaftor. They will correct the misfolded proteins. With ivacaftor. Captor. ये ऑटोमेटिकली एग्जाम हॉल में याद आएगा आपको, टेंशन नको लेना, डोंट मगिफाई इट. ऑटोमेटिकली अरे इवा कैप्टर, बिवा कैप्टर, तीवा कैप्टर, वो सब कहाँ आया? सिस्टिक फाइब्रोसिस, खत्म. दिस इज व्हाट डॉर्नेस अल्फा. इवा कैप्टर, मेरा गट फीलिंग है नीट पीजी 2023 में इवा कैप्टर, सम ट्रैक्टर विल कम. Ivacaftor, lumafactor, tezacaftor. Wow, captor. So you will laugh on 5th evening. अरे क्या टेंशन लिया? इतना easy है क्या entrance? Then muscular dystrophy. X-linked recessive frame shift mutations, truncated or absent dystrophin protein, pseudohypertrophy of the calf, waddling gait, dilated cardiomyopathy is what you need to remember. And deletions are seen both in Duchenne and Becker's dystrophy. Understand? And what is deletion? Exon deletion. Exon deletion. Intron, exon, don't together. One is coding part, other is non-coding part. Intron exon ఏది కోడింగ్ ఏది నాన్ కోడింగ్ చూడండి, క్విక్ గా చూడండి ఒక సెకండ్ లో. ఇంట్రాన్ ఎగ్జాన్ మే హూ ఇస్ కోడింగ్, హూ ఇస్ నాన్ కోడింగ్? కమ్ ఆన్ ఆన్లైన్ స్టూడెంట్స్, వాట్ ఈస్ కోడింగ్, వాట్ ఈస్ నాన్ కోడింగ్ among intron and exon?
Introns are non-coding sections of RNA transcription.
Intron is
non-coding.
Intron is non-coding, extron is expressive. So problem is where large deletions spanning exons. Coding part. Coding नहीं आए तो मस्कुलर डिस्ट्रोफी आएगा. ये क्या होता है डॉक्टर? Pseudo.
Sir, exon there is exoribonuclease. I got confused with exoribonuclease.
So what are you confused now? Are you clear? Exon is expressive, intron doesn't express. Finish. ये क्या है? Pseudo hypertrophy of the calf, which you see in Duchenne's muscular dystrophy. Understand, Italia? What is Gower sign? What is Gower sign? Patient will use because there is a weakness of the quadriceps. So to rise, he has to first put a hand on the knee, then hold the knee and push it back.
Like old people.
Quadriceps, like old people. Quadriceps weakness. And then slowly get up. That's the point you need to remember. So Gower's is seen in Duchenne's muscular dystrophy. This is how the child will be getting up. Duchenne is deleted dystrophin. What is the specialty of dystrophin gene?
Sir, nice way of remembering is introns are
ఎందుకమ్మా exons are expressive?
introns are introverts, they don't.
అదే మరి they don't code. అదే కదా మరి గుర్తుపెట్టుకోవాల్సింది. See, who is exon? Vinisha. Intron, Kaushik. Today our intron is not there, exon is also not there. हम शांति से पढ़ाई कर रहे हैं. Right? हाँ. Good. Intron non-coding says Afroz Sultana. Very good. So good to see Priya Thakur and many more. Very good, Priya. Keep punching whatever that comes to your mind. So loss of dystrophin, increased creatine kinase and allulase is the feature of Duchenne's muscular dystrophy. Becker is X-linked recessive. It is a non-frame shift deletion. That is important. It is less severe. Becker is better. Then myotonic dystrophy. Other day, NEET PG question bank में बैठा है ये autosomal dominant. What is this? CTG. बोलो बेटा. CTG. Trinucleotide repeat expansion in DMK. Dravida Munnetra Kajakam gene. abnormal expression of myotonin protein kinase, leading to myotonia. That means if you give by chance, shake hand, oh, he won't be leaving it. It's all right. It's all right. It's until the bridegroom comes and says, it's okay. You appreciated my bride. Abhi to haath chodo. Sorry, I have myotonic dystrophy. Right? Myotonia. There is a muscle wasting, cataracts, testicular atrophy, frontal balding, arrhythmia. Cataract, 2P, early balding, 2P. And CTG, how will remember CTG? Gonadal atrophy, cataract, 2P, because of the early balding. You'll remember, right? Good, good. So this is the myotonic dystrophy where the patient has a myopathic ptosis. This is the balding. Gonadal atrophy will also be there, right? So this is the frontal balding with the gonadal atrophy is what you need to remember. Myotonic dystrophy. Khatam? CTG. Tomorrow's NEET. They will ask a question. Very good, Priya. Priya says, thank you, sir. Motivating is called motivating. Then comes mitochondrial diseases. Problem kya hai? Mitochondria needed for oxidative phosphorylation. If it is not there, mitochondrial myopathies. What do you get? Mitochondrial myopathies include MELAS, mitochondrial encephalomyopathy with lactic acidosis and stroke-like episode, MRF, myoclonic epilepsy with ragged red fibers, then Leber's hereditary optic neuropathy, and that's what you need to remember. These three are the types of mitochondrial diseases. So this is the Leber's hereditary optic neuropathy where the disc hyperemia and etc. etc. Then comes Rett syndrome. Only girls, only girls, only girls. And what MECP2 on X chromosome? MECP2. So don't forget, doctor, MECP2. CP2. That is MECP2. Is Rett. Between age 1 to 4. Return. It is characterized by regression. Return. Already motor, verbal, cognitive ability, सब कुछ develop होता. Once more, बात करना, walk करना, motor, सब कुछ reverse हो जाता. और ataxia, seizures, growth deceleration, and stereotyped hand rigging is very classical feature. So you can see the girl hand rigging is Rett syndrome, right? So in old age, old times, grandmas used to come and give a slap. Suddenly, if you are doing eyes like this, or you are doing hands like this, or if you keep hand on this. Even my grandma used to have a tradition. While we all, in a typical Brahmin family, used to sit on the ground floor, on the floor, and used to eat food. So if you put the hand and eat, no, used to come and put one slab. So maybe they have some calculation of motor neuron disorders, right? So this is called Rett syndrome, right? So then comes Fragile X syndrome. X-linked dominant inheritance is Fragile X. fMRI, trinucleotide repeats in fMRI. Hypermethylation of cytosine residues lead to this called epigenetic modification. जीन को तैयार होने के बाद उसको कुछ मिथाइलेशन हो गया तो वो एक्सप्रेस करना बंद कर देता. That is the problem here. Hypermethylation of cytosine residues, FMR1, decreased expression is Fragile X syndrome, which is X-linked dominant. जरूर पूछेगा examiner. Most common inherited cause of intellectual disability. Most common inherited cause of intellectual disability. Don't jump and answer downs. It is Fragile X. Most common genetic cause of intellectual disability. Then downs. Inherited is different from Genetic. Trinucleotide repeat expansion. What will be there in Fragile X? CGG. What is that? CGG Fragile X. అది మళ్ళీ వేయాలి, బట్టి వేయాలి. అది ఒకటి అడుగుతాడు పరీక్షాధికారి, ఒకటి అడుగుతాడు పూచేగా ఎగ్జామినర్. 50 to 200 repeats pre-mutation. Full mutation means more than 200 repeats of CGG. Self-mutilation, just like in Leishman, will also be there in Fragile X, is what you need to remember. 7-year-old boy with Fragile X demonstrates a broad forehead and a high-arched palate, is what you need to remember. Now comes trinucleotide repeat expansion diseases, doctor. Huntington's में क्या repeat होगा? CAG. CAG. Caudate has decreased acetylcholine and GABA. C, caudate, A, acetylcholine, G, GABA. Will you remember? Decreased acetylcholine and GABA are decreased in caudate. In Huntington's. Myotonic dystrophy is CTG, it is autosomal dominant. Cataract, 2P, gonadal atrophy, reduced fertility in females. Fragile X syndrome, CGG, X-linked dominant, chin protruding, G for giant gonads, then Friedreich's ataxia. देखो, myotonic dystrophy में CTG होता है gonads atrophy. Fragile X syndrome में CGG and giant gonads. Gonads are fragile actually. Then, because they are giant gonads, Friedreich's ataxia, GA, because it is ataxic gait. Friedreich's ataxia, GA, autosomal recessive. Fragile X syndrome, CGG, X-linked dominant. Then myotonic dystrophy, autosomal dominant, CTG, and Huntington's disease, CAG, and autosomal dominant. One MCQ कल के नीट पीजी में नहीं आए तो मैं खुदकुशी करूंगा. खुदकुशी means to have 2 pegs of alcohol is called खुदकुशी. अपने आप किसी को नहीं शेयर करके. So doctor, very good. Down syndrome, quickly, one question is going to come. All of you know trisomy 21, incurved fifth finger. Gap between first and second toes. Duodenal atresia, Hirschsprung disease, congenital heart disease, especially endocardial cushion defect like ASD, brush field, spots in the iris, associated with early onset Alzheimer's, LG onset Alzheimer's, because chromosome 21 codes for amyloid precursor protein. That is the one which get accumulated leading to early onset Alzheimer's. Increase the risk of AML, ALL in Downs. Please don't forget AML, ALL. It is a meiotic non-disjunction. At the time of meiosis, chromosome 21 is expected to separate equally. If it doesn't separate, you will ultimately get 3 copies. Most commonly during meiosis 1, 4% are due to unbalanced Robertsonian translocation between 14 and 21. 14 का एक piece 21 को मिलेगा. Only 1% are post-fertilization mitotic error. Most common viable chromosome disorder in the world is Downs. Trisomy 13, trisomy 18 सब मर जाते. Monosomy 5 मगर Downs जिएगा. Most common cause of genetic intellectual disability is most common inherited cause of intellectual disability. Then first trimester mein, how do you identify increased translucency of the nuchal area, hypoplastic nasal bones. Markers of Down syndrome kya hai? Remember, high up, HCG increased, inhibin increased, right? Increased risk of umbilical hernia. So what are the 5 A's of Down syndrome? Advanced maternal age, atresia, which is duodenal, atrioventricular septal defect, that is ASD, Alzheimer's disease, which is early onset, AML less than 5 years of age, and ALL more than 5 years of age. AML if it is less than 5 years of age. So super focused content, doctor. So this is what hypertelorism. I may brush field spots. Then incurved little finger. Then absent palm showing deep crease, single palm are fold. ज्योतिष बोलना मुश्किल हो जाता है, इसको सिमियन क्रीज बोलते हैं. मतलब एप्स में भी ऐसा ही रहता, सिंगल क्रीज. जनरली ये रहता ना जीवन रेखा. For whom this touches until here is considered to live up to 90. Don't tell Murli Bharadwaj astrology classes. मेरा तो इधर तक है, तो नो टेंशन, उतना जल्दी मरने वाला नहीं हूं मैं. So I showing white spots which are brush field and first toe big toe के बीच में, फर्स्ट एंड सेकंड टो के बीच में. So that is the story, doctor. This is what increased, nasal bone is absent. Hypoplastic nasal bone, increased nuchal thickness, translucency. Okay, doctor, oh Italia, we need to finish. 2 घंटे हो रहे हैं. 19 सब्जेक्ट्स के लिए 38 आवर्स लगेगा. है क्या हमारे पास? कोशिश करेंगे, क्यों नहीं? जब तक है वहां तक पढ़ाओ. किसको पढ़ाओ? From 13th year of life. Severe intellectual disability, rocker bottom foot, polydactyly, holoprosencephaly, cleft lip, cutis aplasia, pump disease, congenital heart disease, polycystic kidney disease, omphalocele, and defect in fusion in precordial mesoderm leading to midline defects. Right, doc? Then karyotyping of chromosome number 13, trisomy 3, chromosome 13. Critical cry of the cat. Short arm of the chromosome 5, not the long arm. 5 मालूम है मगर long या short मालूम नहीं है, तो भी सत्यानाश हो जाएगा. Microcephaly, high pitched crying. VSD is common. Finally, batti मारने वाला, ultimate batti. ADPKD, what are the things involved in chromosome 4? ADPKD, achondroplasia, Huntington's are all 4. Chromosome 5 is Cri-du-Chat and familial endometrious polyposis also, which lead to colon carcinoma is 5. Chromosome 6 is hemochromatosis. Chromosome 7 is Williams and cystic fibrosis. Chromosome 9 is Friedreich's ataxia and tuberous sclerosis. Chromosome 11 is Wilms tumor. 11 Wilms tumor, because if you do like this, that becomes W. So chromosome 11 is Wilms tumor. And sickle cell disease, beta thalassemia. MEN1 also is 11. Chromosome 13 is Patau-Wilson. Wilms tumor is 11, Wilson is 13. Retinoblastoma also. ये पूरा पटाना कैसे पटाते? देख के पटाते. तो 13th से शुरू होता है पटाव सिंड्रोम और आंखें में होता है पटाव, क्रोमोसोम 13, retinoblastoma. Similarly, BRCA2 is also on chromosome 13. Then chromosome 15. 15 में Papa, Prader-Willi, Amma, Engelmann, Marfan, all of them. Chromosome 16 में ADPKD, tuberous sclerosis type 2. Whereas TSC type 1 is
beta thalassemia 11, sir. Alpha thalassemia 16.
TSC 1 is 9. TSC 2 is 60. 17 is BRCA1, whereas BRCA2 is 13. Mala adokadi gurtu pettukoni savale. Chromosome 18 is Edward, chromosome 21 is Down, 22 is neurofibromatosis type 2. DiGeorge is also 22q11. Then chromosome X is Fragile X and X-linked gamma globulinemia and Klinefelter also. Chromosome 3 is von Hippel-Lindau, 3 letters, doctor. Renal cell carcinoma, 3 letters, doctor, is chromosome 3. Sarve jana sukhino bhavantu. Biochemistry. मृत्युंजय हो गया. I can non-stop teach until 4th evening tak. Then when you are going for exam, no? Poi ragadamma Janaki. Poi ragadamma Janaki. I can give a send off to you to the ससुराल को मैं सेंड ऑफ करूंगा एक भजंत्री लेके. So good. Now orthopedics, एक चाय, कप चाय, ग्रीन टी एक हो जाए, कैसे मिलेगा? नीचे 5 minutes सर, पक्का, क्योंकि ऑर्थोपेडिक शुरू हो जाता. ఉంది green tea. Just have a little walk to prevent sacral edema. So doctor, 5-minute orthopedic starts. Welcome back to the game, Doctor. Who is going to be the NEET PG topper? All of us. Now, Doctor, अगर 2 घंटे में ऑर्थोपेडिक्स को खत्म करे तो there is no bigger hero than us. Let's start. Can the online students can punch whether the voice is loud and clear for all of you? Doctor, please punch. Is the voice loud and clear for all of you? What is the deformity? Favorite MCQ in the NEET PG exam? Flexion, abduction, external rotation, Fabex with apparent lengthening, synovitis. Synovitis में. Flexion, adduction, internal rotation with true shortening whenever there is posterior dislocation. Flexion, abduction, external rotation, Fabex with a true lengthening, not apparent lengthening. Apparent lengthening is synovitis, true lengthening is anterior dislocation. External rotation, shortening is femoral neck fracture. Marked external rotation with shortening is intertrochanteric, bigger, greater and lesser trochanter के बीच में fracture हो गया तो marked external rotation and shortening. Will you remember for me? Tomorrow's exam they will give this question. इसमें क्या है? Flexion है, adduction है, internal rotation है, true shortening है compared to this limb, which is typical of posterior dislocation. Flexion, abduction. This is adduction, this is abduction. External rotation, true lengthening is in anterior dislocation. So external rotation and shortening is in femoral neck fracture. So this is how femoral neck has undergone fracture. Marked external rotation shortening is a feature between greater and lesser trochanter के बीच में अगर fracture हो गया तो marked external rotation and shortening in intertrochanteric fracture. Now let us talk about the hot stuff. Good to see Dr. Tridevi Sunkara, Kamini Sakore, Vinisha Sarde, Kistiji Pachauri, Yamini and everyone. So Vinisha, we are really missing you with all your smiling, cheerful mnemonics. Right? So what is student's elbow? Minor's elbow, olecranon bursitis. Housemaid knee is pre-patellar, clergyman knee is infrapatellar. Weaver's bottom is ischial bursitis, Taylor's ankle is lateral malleolus, bunion is medial side of the great toe. Bunionite, jar, jarina, Mr. Mistress. So, bunionite is fifth toe, bursitis. Student's elbow, minor's elbow, then housemaid's knee is, this is what, ischial bursitis. Then clergyman knee is infrapatellar. This is a little missing. Then weaver's bottom is ischial bursitis. Taylor's ankle is lateral malleolus bursitis. The bunion is medial side of the great toe and bunionite is fifth metatarsal. Now one MCQ is guaranteed, Doctor, in NEET PG. Axillary nerve, where do you see? Whenever there is any dislocation of shoulder, either anterior or inferior, there is a deltoid palsy. Radial nerve, fracture shaft of the humerus in the lower 1/3 leading to wrist drop. Ulnar nerve, fracture medial epicondyle leading to claw hand. Sciatic nerve in the posterior dislocation of the hip leading to foot drop. Common peroneal nerve, knee dislocation or fracture neck of fibula leading to foot drop. Posterior interosseous nerve in Monteggia fracture. Monteggia is upper, closer to elbow. Posterior interosseous. Posterior interosseous nerve is a branch of radial nerve that lead to finger drop. Anterior interosseous nerve in supracondylar fracture. And median nerve is also in supracondylar fracture and that lead to pointing index. So this is the posterior interosseous nerve involvement in Monteggia fracture where the fracture involves proximal 1/3 of the ulna. Anterinteraceous nerve is seen in supracondylar fracture of the humerus. This is called Kilo-Nevin sign. So you ask them to form O with his right thumb and index finger. There's a weakness of the flexion of distal joint indicating lesion of the flexor pollicis. This is straight, this is curved. Flexion यहाँ हुआ या नहीं हुआ, क्योंकि flexor pollicis longus and digitorum profundus muscles are the ones which are affected whenever the anterinteraceous nerve, which is the branch of the median nerve, is involved, is what you need to remember. This is called orator's hand posture. Once more, typically a feature of pointing index in case of median nerve injury. Then there are 10 guaranteed pearls in the NEET PG. What are they, doctor? So once more, I want to tell you, all this is available in the 1200 pages notes on the SCORE learning app. So we give 3-day free pass. Okay? Please call 9000868356. I'm typing here 9000868356, which is the free pass for free activation of SCORE app. Okay, so please call and get your activation and enjoy last moment reviews. Now, doctor, carpal tunnel syndrome में median nerve is affected, which is most common. Pronator syndrome में median nerve compressed beneath the ligament of Struther, where the bicipital aponeurosis or the origin of pronator teres and flexor digitorum superficialis is there. That is the place where the pronator syndrome occurs and median nerve is compressed when it is coming out. Cubital tunnel syndrome is ulnar nerve between two heads of the flexor carpi ulnaris. So whenever somebody is doing cycling, so their Guyon's canal is affected, which is called Guyon's canal syndrome, is ulnar nerve at the wrist, is what you should remember. Thoracic outlet syndrome में lower trunk of the brachial plexus is affected, C8T1. Piriformis syndrome में sciatic nerve. Meralgia paresthetica में lateral cutaneous nerve. Chiralgia paresthetica में superficial radial nerve. Tarsal tunnel syndrome में posterolateral nerve. Motor metatarsalgia में interdigital nerve between third and fourth toe is what you need to remember. So carpal tunnel में क्या होता है, doctor? Median nerve is affected and 3.5 fingers are affected. Carpal tunnel syndrome में median nerve that lead to thenar eminence become atrophied. Pronator syndrome occur whenever the ligament of Struther, through which the median nerve is passing, get compressed, is what you need to remember. Cubital tunnel syndrome में between two heads of flexor carpi ulnaris, when it is passing at the elbow, it get affected. And typically Guyon's canal at the level of the wrist, where the ulnar nerve is passing underneath the facial flexor retinaculum, you get ulnar nerve. Yeah. So there you have the Guyon's canal, is what you need to remember. Okay, doc, this is the Guyon's canal. This is the Guyon's canal. So this is the thoracic outlet syndrome, where the lower part of the brachial plexus. This is the piriformis, where the sciatic nerve get affected. This is the meralgia paresthetica, where lateral cutaneous nerve is affected. Is what you need to remember. Good, doctor. Shivanarayan is asking, sir, tomorrow what subjects? Surgery, drudgery, dialogues. मजे में पढ़ेंगे, खत्म करेंगे 1 day में 8 hours. इसका अंतिम क्रिया सर्जरी, गायनेकोलॉजी, ऑब्स्टेट्रिक्स, फिनिश. ఫార్మా చేద్దామా? చూద్దాం. 4 + 4, 8 hours में. Morning, मैं 8 बजे को आता हूँ, आप आते? Even if you sleep at 3 o'clock, come at 8 o'clock. अगर आप नहीं आए तो मैं नहीं आता हूँ. Yesterday you only called off. I am ready for the date.
Nobody else was coming there.
So we were like sitting.
You are one enough. We would have had 1-to-1 candlelit revision, right? Poolside candlelit revision.
What we were discussing, I asked you. That is the study.
4 + 4, 8. 8 hours discussion. Morning 8 to 12 and evening ऐसा ही 4 to 8. आराम से पढ़ेंगे. परसों final goodbye. 4 + 4, 8 hour session. After that, I'll take 2 large packs of scotch with the 2 tequilas along with a Cuban cigar and wait for the results. How you have done?
See, we mix up the GIT system and genetic urinary tomorrow itself, right? Because it's part of the.
కథం చేసేద్దాం రేపు సర్జరీ సంపి పడేద్దాం. వెరీ గుడ్, థ్యాంక్ యూ మనీష్. Good. 6 narrow palsies and presentations. Erb's palsy, policeman tip. Nerve of bell, long thoracic, winging of scapula. Median nerve palsy is called laborer nerve. Ulnar nerve is called musician nerve because it is the small muscles. Pointing index, benediction. What are the things positive in median nerve? Pointing index, benediction like the Pope. Then pen test. You are hanging pen, you can't touch it, which is because of the abductor pollicis brevis. Abductor. You hold like this.
He's unable to push the pen.
He is unable to reach the pen. Then Ostner's clasp. You ask him to clasp, the pointing finger index will be up. Ostner's clasp. Then opposition of the thumb lost. Ape thumb deformity. Ape thumb deformity. Then ulnar nerve palsy, musician. Book test is Froment sign. Card test is card lagao, palmar interossei, which are the adductors are not working. Igawa's test is DAB, dorsal palm ossei. And book test is Froment sign. Radial nerve palsy mein wrist drop, thumb drop. Whenever the past interosseous nerve is injured, only thumb, remaining wrist. Then common peroneal nerve mein foot drop. So this is the typical Erb's palsy. Erb's palsy. How do they get the portal tip? Basically, the shoulder is rotated forward. Affected arm is diminished in length and girth. There is a muscle atrophy of the affected arm. Waiter tip deformity of the affected wrist. Right? Then doctor. Klumpke mein claw hand because of the wasting of the forearm muscles. Lower brachial plexus. Once more, Herpes, increased angle between the neck and shoulder. Neck and shoulder. Like obstetricians which are causing traction. Or when you are falling like this. There is an evolution of C5, C6, which are the upper rami, is Erb's. Klumpke, you are trying your best to, you are falling before NEET PG exam, but somehow we are giving a crash course to prevent you from falling. You are just holding it, right? So that lead to Klumpke, C8T1. Similarly, Lovesitt's maneuver, where the hand you are holding and pulling him out can cause traction leading to that, right? Then this is the winging of scapula. Abductor pollicis brevis is the one which is affected whenever you are doing the pen test to detect the median nerve. Then dorsal interossei, palmar interossei, Igawa is DAB, dorsal interossei. So Igawa is DAB. Then what is Froment sign? Froment sign is also seen in ulnar nerve. You ask him to hold a book, then it will be straight. But here it becomes flexed because there is a flexion at the interphalangeal joint which is compensatory. in Fromenstein. Flexor pollicis longus will try to compensate for the loss of the adductor pollicis, which is supplied by ulnar nerve. Flexor pollicis longus is supplied by median nerve. So median nerve is still intact. It will try to compensate and that lead to flexion. So common question asked, ulnar nerve, Fromenstein is for ulnar nerve damage. Which muscle weakness? Adductor pollicis. Which muscle is compensating? Flexor pollicis longus, which is supplied by median nerve, is what you need to tell. This is the ape thumb deformity, and this is the hand of benediction, because there's a flexion get affected, and this is the pointing index, all in the median nerve. So once for median nerve injury above the cubital fossa. So once for upper level, lower level. So when patient clasps the hand, the index and middle finger, interphalangeal joint and the terminal phalanx of the thumb, they are unable to flex because of the anterolateral nerve injury. Benedict sign. Clasping gani Benedict gani anta okate. Index and middle, interphalangeal joint, terminal phalanx of the thumb are unable to flex. That is called anterolateral nerve injury. Loss of flexion of the index and middle finger is because of the paralysis of the flexor digitorum superficialis and the lateral half of the flexor digitorum profundus, which is supplied by the anterolateral nerve of the median nerve. Then this is what resisted adduction of palmar interossei in the ulnar nerve injury is what you need to remember. One MCQ आएगा डॉक्टर, इसमें से doubt ही नहीं है. 60 online, at least before I finish the session, 100 आए तो बहुत मजे में पढ़ेंगे, फिर भी मजे में पढ़ेंगे, ठीक है? तो डॉक्टर, very good, very good. So those who like to try 3 days of free activation of Score Learning app, 900868 हमारा हेल्पलाइन भाग्यलक्ष्मी को कॉल करो, आपको 3 दिन के लिए एक्टिवेशन देगा until 5th. All right. So now, doctor, what are the 40 clinical signs in orthopedics which are favorite question? One question जरूर आएगा. Adson's test the other day you did wrong. Thoracic outlet syndrome में Allen's test for testing the patency of radial and ulnar arteries. Allie's test is done in congenital dislocation of hip. Anvil test to know the tenderness of the spine. Ape thumb for median nerve. Aptly grinding test for what will you grind me? Meniscus ko mixie mein dalo. Apprehension test, recurrent dislocation of the shoulder. Recurrent failure in NEAT PG will lead to apprehension test positive. उसको छोड़ दो apprehension को. Barlow, DDH. So Adson test means there are tight scalenes. Monitor the patient pulse. Extend the arm at elbow. Extend, externally rotate, slightly abduct the shoulder. Ask the patient to take a breath, deep breath, while turning head towards ipsilateral arm. Severely decreased or absent radial pulses. Adson. Adson is a feature of thoracic outlet syndrome. Similarly, what is Alice? Dono knee joints ko dekho. Because of the dislocation, there is a shortening and one side it will be lower than the other side, which is called Alice test to know the congenital dislocation of hip is what it is. Apley's distraction test and Apley compression test. So they are all fundamentally for meniscal injury ko identify karne ke liye. Apley grinding test. Ask the patient to lie down in a prone position and then flex the knee joint and then you do the grinding job. Anterior apprehension test in recurrent shoulder dislocation. Then Barlow maneuver, Ortolani maneuver. So you try to dislocate. Dislocating is Barlow, relocating is Ortolani. You are barring, means you are dislocating. and you are relocating is ortolani.
So
Okay?
Alice is nothing but Galeazzi test.
Galeazzi test and LN are same. Ali and Galeazzi are same. Now, doctor, what are the 12 bursitis? Housemaid's knee, prepatellar bursitis. Clergyman's knee, infrapatellar bursitis. Breaststroker's knee, bursa under pes anserinus. What is pes anserinus? Sartorius, gracilis, semitendinosus, thinonca. Common thing is pes anserinus, which is called breaststroker knee. Student's elbow or minor's elbow is olecranon bursitis. Golfer's elbow is medial epicondylitis. Tennis elbow is lateral epicondylitis. Tennis is lateral, golfer is medial. Okay? So lateral epicondyle and medial epicondyle, which is the origin of flexor tendons, and what is the origin of all the extensor tendons? Huh?
Median is flexor.
And lateral is extensor. So you will be doing tennis खेलते वक्त extend करोगे ना? So lateral epicondylitis. Reverse bottom ischial bursitis. Then what is Moran's cyst? Typically median popliteal cyst in rheumatoid arthritis and also osteoarthritis. So what is Brody's bursa? Bursa under the medial head of the gastrocnemius is called Brody. Taylor's ankle, lateral malleolar bursitis. Tubercular bursitis typically is more often trochanteric bursa. Trochanteric bursitis and even Palmar, compound Palmar bursa. Ganglion bolte isko. Compound Palmar bursa. Wrist mein. Bunyan means bursitis on the medial side of the great toe. Bunyanetti is fifth. Already we finished. So what is this, Dr. Baker cyst, which you see in rheumatoid arthritis and osteoarthritis? याद आएगा या नहीं आएगा? जरूर आएगा, क्योंकि 48 hours easy retention. You're all brilliant kids. Now, doctor, blue sclera, osteogenesis imperfecta. Briand test for anterior dislocation of the shoulder. Callaway's test, you will calculate the girth of the shoulder. Increased girth means there is a dislocation. Axillary fold को observe करते हैं Briand में. Chopstick is for tetany, claw for the ulnar nerve, coin test for dorsal lumbar TV of spine, Cogen for tennis elbow, lateral epicondylitis. Then drawer for ACL PCL, आगे पीछे ACL PCL drawer test. Anterior for ACL injury, posterior for PCL injury. So this is what Dr. Hamilton Ruler's test. From the acromion to the elbow. It will be a straight line. Generally, it won't be straight line because deltoid prominence is there. Once anterior dislocation is there, axillary nerve injury is there. Once they lose the deltoid prominence, that leads to straightening of the border. Callaway's test, Dugas test is what you need to remember. The vertical axillary circumference is increased in Callaway. Cogen's test, टेनिस एल्बो, लेटरल एपिकोंडाइलिटिस को फिर बार बार जहां प्रॉब्लम है वहां ज्यादा करके दर्द को महसूस करने को टेस्ट बोलते हैं. एंटीरियर ड्रॉयर टेस्ट इज फॉर एंटीरियर posterior cruciate ligament. Correct? Not meniscus. Okay. Now, Finkelstein for D. Quervain stenosynovitis. Finkelstein. Right. This is painful.
Yeah, so this is painful.
D. Quervain stenosynovitis. Foot drop for common peroneal injury. Fromens for ulnar nerve injury. Gainslin's test. इसको ऐसा थाइस को उनको लेटाओ और थाई को ऐसा करो ताकि pain. That is called Gainslin's test. So no, once I just took an ortho class and went to OP. So, Bhavani is my patient. She is about 78-year-old, very intelligent. Amma, this is called as Ganslin's test to detect your sacral one joint. I told her. She remembered that word very manchi word and doctor. That Ganslin's test. Just because having taught her every time I need to do and show this is all right. She lived up to 86 and one day passed away. Right? So Galeazzi for congenital dislocation. Gover, Duchenne muscular dystrophy. Hamilton ruler, anti-dislocation. Lasigue for disc prolapse. Lasigue. You do a little bit of stretch and then that prolapse and disc will cause pain. I'll come to that. So what is this, doctor? Finkelstein pain, tenosynovitis. Ganslen is for S1.
Ganslen is for
sacral. Then Patrick or Faber test. This is also another way to do the stretch and then find the presence of the inflammation. Hamilton ruler. Whenever dislocation is there leading to deltoid atrophy, you look at the straightening. Lasigue is basically hamstring tightness. This is called straight leg rising test. So then what more? Next 40 clinical signs, 1 MCQ कल के NEET PG 2023 में आएगा. Lachman, anterocruciate ligament. Ludloff for avulsion of lesser trochanter. पहला नाम सुन लो, बाद में कैसे करते देख लेंगे. McMurray meniscus injury. Knuckfi-Geiger for disc prolapse. Ober for tight iliotibial band. O'Donoghue triad means dangerous triad. MCL, ACL and medial meniscus. Ortolani for DDH. Pivot shift for anterocruciate ligament. Pivot shift. Now let us start. Lakshman, Ram kahan hai, Lakshman kahan hai? Lakshman kaise karoge? Examiner grabs the patient's lower thigh. Then at same time, the examiner uses the other hand grasp and the proximal tibia. Next, the examiner then firmly pulls the tibia anteriorly. Dig. Any movement है तो लक्ष्मण वो राम बोलेगा तुम लक्ष्मण कर रहे हो. Hey Ram बोलेगा. Right? So then what is Ludloff? Make the patient in seated posture, unable to raise the affected limb from table. Whenever lesser trochanter fracture is there, separation, avulsion, then patient is in seated posture, unable to raise affected limb from the table. Then ecchymosis and edema in the Scarpa's triangle. That is called Ludloff. McMurray examination of the medial meniscus, and the other one is lateral meniscus tear. McMurray. So during fundamentally उसका prone position में लिटा के आप grinding कर रहे हैं, regular supine में लिटा के McMurray कर रहे हैं. Then Fager's Fager-Stosn sign. Crossed straight leg rising. It favors central dislocation. Neris, forward bending causes flexion of the knee on the affected side. All these are sciatic stretch tests. खेलते खेलते देखो अगर होता तो सुनो नहीं तो छोड़ दो. So this is a Knuckfi-Geiger. This is Valsalva maneuver करे तो भी pain आता. Whenever disc prolapse is there. Ober बोले तो grasp the distal end of the patient's leg, flex the leg to right angulate the knee, stabilize the upper iliac crest with one hand. ये सब करके क्या prove करना चाहते हो? Tight Tibiofemoral ligament or iliotibial band, ITP band. This is the anterocruciate ligament. This is the posterior cruciate, medial meniscus, medial ligament. O denotes triad. Already you know what is Barlow. Bar is dislocating, Ortolani is relocating. Is what you need to remember. All right, doc. So continuing our journey. Sciatic test sir, red light area sir. उसको पढ़ने से भी याद नहीं रहता. बोल रहे कि निश्चल. This is called YouTube pessimism. अरे please. कुछ भी याद नहीं रहता बोल के रखो. तो ऑटोमेटिकली जो भी याद आएगा आएगा. నాలుగు రోజులు పాఠం చెప్పాలి మా శిష్యులకు. నేను లేకుంటే కష్టమైపోతుంది. నిశ్చల్ అంటుండు ఫస్ట్ టైం చూస్తున్నా సార్ ఈ టెస్ట్లు ఏం యాదుకుంటుంది. అందరం ఫస్ట్ టైం అయినప్పా. At least that first time is not happening in exam hall. Then policeman tip Erb's palsy. So what is runner's knee, doctor? Patellar tendinitis. What is sulcus sign? Whenever there is the inferior stability of the shoulder, एक sulcus form हो जाता. Thomas test is for hip flexion deformity. Trendelenburg for unstable hip. Tinel sign is to detect the nerve injury. ఏం లా ట్రెండ్లెన్ అంటే ఏం లేదు. ఓకే గుడ్. అట్లా అట్లా గురుగారిని క్వశ్చన్ అడిగితే కొంచెం ఖుషి ఉంటుంది. ఇగోండి ఓకే బొమ్మనే ఉంటాయి కదా ఏడను. ఒక్క నిమిషం ఉందాం. ట్రెండెన్బర్గ్ ఇది డాగ్ వెరీ సింపుల్. వాట్ ఈస్ దిస్? గ్లూటియస్ మీడియస్. It abducts the
opposite side.
It's an abductor, so it will abduct the opposite thigh whenever that particular side is unsupported leg. Suppose if it is weak, then what will happen? This can't be pulled towards it. So that is the reason the side hip will be jug jayega by the gravitational pull. This is called Trendelenburg. What is waddling gait? When they are walking, if the gluteus medius is both the sides weak, like in polio and all that, then whenever you are walking, lifted the leg, that side jukega. Next, you will land this leg and then lift this leg while walking. Back. Waddling will start. That is called gluteus medius, not maximus, which is an abductor. And which side sinks? The side where there is an unsupported leg, which is opposite to the side of weakness of gluteus medius. Wo clarity rehna. All righty. Now let us see. Anyway, you know extension at elbow joint, pronation at radioulnar joint, and adduction and medial rotation of the shoulder joint. Sulcus sign. So typically you can feel the sulcus whenever there is inferior instability. This is called inferior instability lead to development of a sulcus. Thomas test is basically you make him to lie down. When you are flexing it, this won't rise. But here he can flex only if this side rises above the table. That is called Thomas. Huh? It is meant for any hip flexion contracture. Hip flexion contracture ఉందనుకోండి, అప్పుడు ఇది లేపినప్పుడు ఇది కూడా లేస్తుంది అది. సో So this is called Oakman's ischemic contracture, where there is a clawing of the hand. So is a typically flexion of the fingers on active wrist extension.
Extended here, extended.
There is a wrist flexed.
Yes.
Bulkier flexors, therefore more contraction. There is an extension at the metacarpophalangeal. Metacarpophalangeal lonemo extension. Because the insertion of the extensor tendon into metacarpophalangeal joint. Flexed interphalangeal joint, because of the insertion of the long flexor tendons which are contracted, is called as Oakman's ischemic contracture. These are flexed, doctor. Metacarpophalangeal joint is extended.
Flex, extension, flex.
Extension at interphalangeal, metacarpophalangeal, flexion at interphalangeal because the flexor contraction. Okay. Then 16 joints involved. One question will come from this. Syphilis involved knee, gonococcal arthritis knee, gout is first big toe metacarpal, metacarpophalangeal, metatarsophalangeal. Favorite question. Pseudo gout involved knee joint, all that calcinosis. Understand? Chondrocalcinosis. Calcium pyrophosphate crystals. Rheumatoid arthritis involve MCP joint. It never involves a dip joint. Dip joint only involved in two arthritis. One is osteoarthritis, other is psoriatic arthritis. Beautiful. You remember, no? Only dip is involved in OA and psoriatic. It is never involved in rheumatoid arthritis. So it is metacarpophalangeal joint. Agreed, doctor? Then ankylosing spondylitis is sacroiliac joint. Diabetic Charcot joint is foot joint in tarsals. Senile osteoporosis involve vertebrae. Paget's disease is pelvic bones. Paget's. Pelvic bone more than femur, more than skull, more than tibia. All these bones become thickened. Then osteochondritis dissecans, loose bodies are found in knee joint. Actinomycosis involves the mandible. Hemophilic arthritis, all knee become big, swollen. Disc prolapse commonly between L4 L5. Acute osteomyelitis is along the lower end of the femur where metaphysis, which is rich in blood supply, is common for hematogenous osteomyelitis. Brody's abscess is along the upper end of the fibula. Fatafat below. Hemophilic arthritis of knee. Brody's abscess in the upper end of the tibia. Ankylosing spondylitis is sacroiliac joint. Diabetic Charcot foot is involving tarsals. Osteochondritis dissecans is loose bodies in the knee joint. So these are all like last moment Diwali patake. पूरा street में spread करके रखते ना, top. Like that you have to. मजे में पढ़ना है. रोते हुए जाएंगे नहीं, नीट पीजी को हम हंसते हुए जाएंगे. Right? हाँ. Now, Shrumen. Osteochondritis का unfortunately one नाम रहता. इस नामों के ऊपर एग्जामिनर भजन करेगा. Shrumen. Vertebra की ring epiphysis का osteochondritis. Osteochondritis dissecans. Lateral part of medial femoral condyle. Sewers. Calcaneum. Then Panner. Elbow. Osgood-Schlatter, commonly asked. Tibial tuberosity. Freeberg, second metatarsal head. Kienbock. Lunate. Perthes, femoral head. Johansson-Larsen, lower pole of patella. Calves, central body of nucleus of vertebra. Don't confuse with Shrumen. Eileen, fifth metatarsal. Kohler, navicular. Yavani pair reserve just పెట్టుకున్నాడు. సావగొట్టడానికి మనని. మనం ఏమో చదువుకుంటూ చావాలి లాస్ట్ మూమెంట్లో. Now this is Shrumen. Shrumen is vertebral ring epiphysis. Then this is what? Osteochondritis dissecans, which present like a loose body. Severe is calcaneum. Panner is capitulum of elbow. Then Osgood-Schindler is tibial tuberosity. Freiberg is second metatarsal head. Kienbock is lunate. Perthes is completely decided. Femoral head is compressed and destroyed. Johansson-Larsen is lower pole of the patella. Osteochondritis dissecans is loose body in the knee joint. Severer, Osgood-Schindler, Freiberg. Then Kohler is navicular bone in the foot. Then that is the story. Eileen. हम बहुत खुश हैं 65 हम 100 को पहुंच रहे हैं कभी भी कैसा भी. So doctor, nowadays coaching gurus have become like political parties. हमारे सभा देखने के लिए कितने लोग आए हैं, इसलिए लॉरी में बुलाओ, वैन में बुलाओ, और हैदराबाद में है तो आओ हमारे नामपल्ली सेंटर को. हम बिस्कुट, चारमीनार बिस्कुट, उसके साथ गर्मा गर्म चाय भी पिलाएंगे. राइट? सो एंजॉय द प्रिपरेशन डॉक्टर. लास्ट मोमेंट आई एम देयर. इफ यू आर ए लिसन एंड टॉपर टाइप ऑफ मटेरियल है या नहीं पहला देख लो. यू आर ए गुड लिसन टू बिकम टॉपर kind of material hai to Murli Bharadwaj will be there 8 hours tomorrow, 8 hours day after tomorrow with you. Right? My promise. Flattening of the shoulder dislocation. Dinner fork deformity, Colles fracture. Dinner fork. Opposite is Smith. Idemo dorsal dislocation. Edi mana dorsal, yes, sir. Ventral displacement, Smith. Mallet's finger is avulsion of the insertion of the extensor tendon onto the distal phalanx. Mallet. Flexion adduction, internal rotation. Posterior dislocation, flexion abduction, external rotation is anterior dislocation, septic hip, synovitis, iliotibial band contracture in polio. All of them is FAVEX. Then external rotation of the leg in fracture neck of femur, intertrochanteric fracture, where lateral border of the foot will be touching bed. गिर गया. So what is this, doctor? इधर से इधर को आप स्केल लगाए तो एक ही लाइन पे रहता. This is the flattening of the shoulder. This is the dinner fork deformity, dorsal displacement. This is a spade deformity due to Smith's fracture. This is the mallet finger, avulsion of the insertion of the extensor tendon is what you need to remember. Now, doctor, 10 nerve injuries in orthopedics. Anterior or inferior shoulder dislocation will affect axillary nerve. Fracture surgical neck of humerus also, axillary nerve. Fracture shaft of the humerus, radial nerve. Fracture supracondylar fracture, anterosseous nerve, which is the branch of the median nerve, more than the median, more than radial. Then ulnar, Amru. Medial epicondylar fracture, ulnar nerve. Monteggia, posterior interosseous nerve, which is the branch of radial nerve. Walkman systemic contracture, anterior interosseous branch of median nerve. Lunate dislocation में median nerve. Hip dislocation में sciatic nerve. Knee dislocation में peroneal nerve. Finish. Then comes 5 hot orthopedic tests for NEET PG. Canaveral sign is acute suppurative tenosynovitis of the ulnar bursa. Little finger. Canaveral. Canaveral में 4 components. The affected finger is held in flexion. There's a fusiform swelling on the affected tendon. There's a tenderness over the affected tendon. There's a pain on passive extension of the affected finger. That is little finger due to ulnar bursitis. Clear? Then Cosen's test to detect the tennis elbow. Patient is seated with the elbow extended, forearm, maximal pronation, wrist radially abducted, and hand is in a fist. And the patient is asked to move the wrist to dorsal flexion, and the therapist, simple Cosen tennis. भगवान को प्रार्थना करो, मैं तो इतना छोटा बच्चा हूँ, ऑर्थोपेडिक्स में इतना बड़ा बड़ा कुंग-फू शॉट्स ऑफ ब्रूस ली, एंड मैं तो कुंग-फू पांडा हूँ. भगवान कोजन बोले तो टेनिस एल्बो पास, उससे ज्यादा पूछो मत. ऊबर नहीं, ओवर. टाइट इलियोटिबियल बैंड पोलियो में, फिनिश. Finkelstein dequervance में, Fallon's flexion test in carpal tunnel syndrome where your median nerve more compressed, right, on forced flexion of wrist. Finish. हो गया. Then Salter Harry इधर दरिद्रप कोट्टू छी पिच्ची टॉपिक है. అయినా एग्जामिनर ఒక क्वेश्चन అడుగుతాడు, ఊరుకుంటాడా? जो डर गया ओ मर गया, राइट? हाँ, तो इसलिए याद आएगा या नहीं आएगा? क्यों नहीं आएगा? टाइप 1 सिंपल डॉक्टर. टाइप 1 is physis growth plate. Slipped capital femoral epiphysis is type 1. Treatment closed reduction. Type 2, most common is type 2. Most common type 2. Fracture involving physis plus metaphysis. Example is distal femur fracture, supracondylar fracture. Distal femur, supracondylar. Treatment closed reduction. Most common supracondylar distal femur doctor. Then type 3, fracture involving physis plus epiphysis. फाइसिस मेटाफाइसिस के साथ है तो 2 है, एपीफाइसिस के साथ है तो 3 है. टिल्लॉक्स फ्रैक्चर ऑफ टिबिया, टिबिया एंकल के लेवल पे, थिल्लाना टिल्लॉक्स. ट्रीटमेंट ओपन रिडक्शन. तिल्लाना ज्यादा करे तो टिल्लॉक्स होगा, ओपन रिडक्शन, फाइसिस प्लस एपीफाइसिस. टाइप 4 इन्वॉल्व सब कुछ एपीफाइसिस, फाइसिस, मेटाफाइसिस. फ्रैक्चर लेटरल condylar of the humerus where you get tardi-ulnar palsy. लेटरल condylar है तो cubitus valgus and tardi-ulnar palsy. इसको बोलते हैं फ्रैक्चर ऑफ नेसेसिटी. So you need to do open reduction and internal fixation. Type 5 is fracture involving crush injury of physis, which is typical of lower tibia का lower tibial epiphyseal injuries. Example where ऊपर से जंप करे तो लोअर का टिबिया का फाइसिस क्रश हो जाएगा. ट्रीटमेंट कंजर्वेटिव, कुछ भी नहीं कर सकते, राइट? देन remember Salter, slipped above lower through ruined. Means?
Ruined is crushed, sir. Through is...
Acha, slipped capital epiphysis. Yeah. Above means?
Metaphysis.
Above metaphysis. Okay, leave it. Salter Harris type 6 is ablation of the pericardial ring which is present at the distal end of the metaphysis को क्या बोलते हैं? Type 6. And type 2 and 4 में small metaphyseal fragment को Thurston-Holland sign, क्या है? Thurston-Holland sign is found in type 2 and type 4 where the metaphyseal fragment is small one, which you can see. अभी देखेंगे. अरे, sorry, the images are missing, but this is one classical radiological sign many times asked Dr. Be sure. Thurston-Holland sign. ఏదో ఒకటి చేసి జర గుర్తుపెట్టుకోండి. 2 మోస్ట్ కామన్ అప్ప, 1 physis అప్ప, 2 మోస్ట్ కామన్ అప్ప, इसमें physis metaphysis affected అప్ప. కానీ the one who remembers this last moment before going into nuptial night, तेरे देख लेके जाना एग्जाम को, वो लिस्ट में डाल दो इसको, क्योंकि डेफिनेटली एक साल्टर हैरिस अब जाते जाते वक्त बीच में बाइक रुक के आंजनेय स्वामी टेंपल को जाके साल्टर हैरिस नहीं आना भगवान, मैं 10 कोबरकायल गुड़तानु, सडनली एज यू गो फर्स्ट विल बी साल्टर हैरिस. तो इसलिए एक बार देख लो. Now clawing of hands. Why will clawing of hands occur? There's an imbalance between strong extrinsic muscles and weak and intrinsic muscles, interossei and lumbricals. Because of that, metacarpophalangeal में hyperextension, proximal interphalangeal and distal interphalangeal में flexion. That is the funda of clawing. Metacarpophalangeal में extension, इसमें flexion. अल्नार पैराडॉक्स क्या होता है? जनरली हायर इंजरी, लोअर इंजरी. You expect higher injury to have higher deformity, but it will have lesser deformity. Why? Because fundamentally what? If only flexors are affected, extensors are not affected, then what do you get? Clawing. So typically whenever the wrist level pe ulnar get affected, only flexors are affected, extensors are not. Whereas upper level में क्या हो गया? Both are affected. मैं भी नहीं पढ़ता हूँ, मेरा रूममेट भी नहीं पढ़ता है, दोनों को सीट नहीं आता है, हमको क्लॉइंग नहीं रहता. दिक्कत कहाँ होता है? मैं नहीं पढ़ता, वो पढ़ता. प्रॉब्लम वो है. तो so the ulnar lesion, whenever it is at higher level, will be closer to the paw, worse will be the claw. Upper level, away from the paw, claw will be less. So इसलिए पप्पा से दूर रहो ताकि क्लॉइंग कम रहता. Ulnar nerve also innervates medial half of the flexor digitorum profundus muscle. So, in proximal ulnar nerve lesions, flexor digitorum profundus muscle also is denervated. As a result, flexion of the IP joint is weakened, which reduces the claw-like appearance of the hand.
Yes, sir. Yes, sir.
Whenever the interossei lumbricals are affected, so this flexor digitorum profundus का ulnar, flexor digitorum profundus जो है ना, it is the one responsible for clawing. But if upper part is involved, even that is also involved. So that is the reason no clawing. That's the point. Okay. Now 44 most common in orthopedics. Most common ligament injury in knee joint, medial lemniscus. Most common ligamental injury in the body overall, anterior talofibular ligament in ATFL. Anterior talus fibula के बीच में जो भी ligamental tangle है, that's the most common ligamental injury in the sprain in the body. Most common location injured in the body is tendon, Achilles tendon. Most common tendon. Most common peripheral nerve injury is radial nerve, not medial, not ulnar. Best prognosis after peripheral nerve injury also radial nerve. Radial readily damages, radial readily heals. जल्दी डैमेज होता है, जल्दी हील हो जाता है. Most common type of Salter Harris is type 2. Most common type of spinal TB is paradiscal, but that means lower half of the upper vertebra Upper half of the lower vertebra along with the intervertebral disc also involving is paradiscal. Most common site of stress fracture, second and third metatarsal, when you are continuously walking. Most common bone to get fractured is tibia because it is subcutaneous. Most common bone to get fractured in newborn is clavicle. Okay, obstetrician roughly pulls him out. Most common bone to get fractured during childhood around elbow is supracondylar fracture. Originally, orthopedics क्यों बोला? No, pediatrics में bone fracture को set करने के लिए शुरू हुआ, बाद में adults में गया. Now, most common elbow injury in adolescence is physeal injury. Most common site of osteomyelitis is tibia, that too in the metaphysis of tibia, not femur. Most common site of Brody's abscess is tibia at the metaphyseal-diaphyseal junction. Gary's osteomyelitis is at mandible. Skeletal TB is lower dorsal spine. Thoracic spine, the lower part is the most common site for skeletal TB. Most common joint to undergo dislocation, shoulder. Most common complication of fracture clavicle is malunion, not non-union. Most common complication of anterior shoulder dislocation, early is injury to axillary nerve, late is recurrent dislocation. Most common complication of supracondylar fracture is malunion leading to cubitus varus. Idi valgus, idi varus. Idi. Gun stock deformity. Clear? Itlu unte kadappa. Itla. You didn't get it. No, ma. This is your normal hand now.
Yeah.
So this will be
Bender.
ఇది బెండ్ అయితే ఇట్లా ఇట్లా బయటికి ఇది ఇట్లా కాకుండా ఇట్లా అవుతుంది ఇట్లా అవుతుంది అవుటర్ కర్వేచర్ ఇన్స్టెడ్ ఆఫ్ ఇన్నర్ కర్వేచర్ ఇట్ ఈస్ ది అవుటర్ కర్వేచర్ సో దట్స్ కాల్డ్ గన్ స్టాక్ డిఫార్మిటీ ठीक है now doctor gun stock the most common complication of fracture lateral condyle non-union and cubitus valgus ఇక్కడ ఒక ఫిక్స్ ఉన్నది ఇదేమో మాల్ యూనియన్ తో క్యూబిటస్ వారస్ ఉన్నది ఇక్కడ నాన్ యూనియన్ తో క్యూబిటస్ వాల్గస్ ఉంటుంది lateral condyle it is not growing, this one is only growing because the non union of the lateral condyle medial is only growing and that lead to valgus, that lead to ulnar nerve tardi ulnar palsy. Clear? Don't confuse. Fracture lateral condyle may be a cubitus deformity. Supracondylar fracture may be cubitus, but cubitus varus of the supracondylar fracture is malunion. Cubitus valgus of fracture lateral condyle is non-union. Most common complication of fracture scaphoid is avascular necrosis. So what is this, Dr. Gary's osteomyelitis of the mandible? Clear? Orthopedics is very scoring. Out of 10 एक बार पढ़े तो भी आप 8 out of 10 आंसर करके बाहर निकलोगे. उतना सिंपल है. कॉम्प्लिकेट आए तो कोई भी आंसर नहीं करेगा. सिंपल को आंसर करने के लिए कम से कम एक बार पढ़ना पड़ेगा. वो कर रहे हैं अभी हम. ठीक है? Now, most common in orthopedics, most common during childhood, green stick fracture. Most common carpal bone to get fracture, scaphoid. To dislocate, lunate. Pathological fracture is typically found in vertebral body of the thoracic spine. Pathological fracture. Whenever tumor is there, osteoporosis is there, etc. Most common cause of osteomyelitis is staph aureus. Most common cause of pathological fracture is osteoporosis. Metastasis to the bone also can cause pathological fracture. So what is this, doctor? First to understand, this is scaphoid, this is thumb, and inside the scaphoid there is a fracture. Neck of the waist of scaphoid में. Most common joint involvement, actinomyces में mandible, diabetes में mid tarsal, gout में MP joint. Leprosy में joints of the hand and foot. Myelomeningocele में ankle and foot. Tavis dorsalis of syphilis में knee joint. Syringomyelia में shoulder and elbow. Now, most common complication for Colles fracture, malunion, dinner fork deformity. Antidislocation में most common axillary nerve injury. Most common in acute osteomyelitis. Complication is it become chronic. Most common complication of not getting seat in NEET PG, preparing for INI CET. उससे ज्यादा कुछ भी नहीं होता. Maximum शादी होता. Most common, that is a serious complication. Most common muscle involved in Volkmann systemic contraction is, please don't forget, FDP more than FPL. Or more. Flexor digitorum profundus. Digitorum profundus, most common. Marshpodi, adutadu. Need PG tuklak data adutadu. నువ్వు ఎగ్జామ్ హాల్లో పోతేనే వినీష్ అన్నాడు గట్టిగా అడుగు. హే ఎఫ్పిఎల్ఆ ఎఫ్డిఎల్ఆ ఏమి ఇన్వాల్వ్ అయింది వినీషా? అయిపోయి కథ. దేంట్లోనండి మీరు? మా స్కోర్ యాప్లో అండి. ఎఫ్డిపి మోర్ దెన్ ఎఫ్ जरा एडवर्टाइजमेंट करो मेरे लिए एग्जाम हॉल पे. Median nerve. Most common nerve involved in Volkmann systemic contraction is median nerve. मुझे एक नाइटमेयर आया, मालूम है? नितिना ने टॉपर बना. No, that's what it should be good thing, no. मगर नाइटमेयर आया तो YouTube में वो इंटरव्यू दे रहे, मैं वो कोचिंग सेंटर को गया, ये कोचिंग सेंटर को गया. कभी स्कोर ऐप के बारे में, मुरली भारद्वाज के बारे में बोलेगा मेरा चाय पत्ते का खर्च कम से कम निकलेगा, मैं देख रहा हूं. वो नहीं बोल रहे. तो देन आई गॉट दिस इज मीन अनजस्ट बोल के मैंने उठा. She said, don't worry sir, वो कोचिंग सेंटर वालों ने 50 लाख दिया, ये 50 दिया, सो पूरा कुल मिला के 2 करोड़ मिला, उसमें से आपको 1 करोड़, मेरे लिए 1 करोड़. That is the good news. Definitely. आप कोई भी टॉपर को देखो, वो फर्स्ट डे ये ऐप के वजह से बोलेगा, विद इन अनदर कपल ऑफ आवर्स इसका कोचिंग बोलेगा, उसका कोचिंग, सारे 4-5 बोल देगा, पूरे 1-2 करोड़ आएगा. आई एम ऑल्सो थिंकिंग, why don't I write entrance exam so that I will tell I am because of that coaching, this coaching and my own coaching. Good. So have good positive vibed dreams, no negative dreams. So most common nerve involved in supracondylar is anterolateral nerve. Outstretched hand, very important. Elderly में है तो Colles. Children में supracondylar fracture of humerus. Both of them are outstretched. Most common injured ligament of the knee is ACL. Most common injured in torsion of the knee also is ACL. Meniscus is, among menisci, medial is more than lateral because medial is attached. उसका बंधन है किससे? medial longitudinal ligament से. वो नहीं मूव हुआ तो वो ये भी नहीं मूव होगा, दोनों सत्यानाश. Then Allen's test is for ulnar radial artery patency, Thomas Hypens, Ludloff Hypens, Phelps is for tight gracilis. Ludloff marchpodu lesser trochanter avulsion. Okay, so this is the tight gracilis which is identified by Phelps. Now few eponymous names. Pivot shift test, where do you use? ACL. Between Lachman and pivot, which is more sensitive? Lachman is more sensitive as it can be done both acute as well as chronic. Lachman test is for ACL injury. Andrew-Droid test is also ACL injury, posture draw test for PCL injury, valgus test for valgus बोले तो बाहर खींचोगे या अंदर?
Under.
No, gum is under.
Valgus is under.
So
Valgus varus, outer curvature is varus, inner curvature is valgus. So imagine that at least valgus is medial collateral, varus is lateral collateral, Macumurre, M is meniscal injury. At least tomorrow's entrance में it is for cruciate ligament injury के लिए नहीं बोले तो काफी. वो meniscal injury के लिए क्या है, cruciate ligament के लिए क्या है, medial collateral ligament के लिए क्या है, याद रखोगे ना, टेंशन नहीं है ना. वो अम्मा gus is medial, rus is lateral. Rus is lateral, gus is medial. Whatever it is. Okay, remember only one. Good.
One correctly.
Huh?
Only one correctly.
Okay. Pivot shift test, varus stress test, etc. Okay. Now, Colles में what is the main complication? Malunion and stiffness of fingers. Supracondylar fracture of humerus में malunion, gun-stalk deformity. Lateral condylar humerus में non-union. Clavicle fracture में malunion and shoulder stiffness. Intertrochanteric fracture में malunion with shortening. Fracture neck of femur में avascular necrosis. Scaphoid fracture also avascular necrosis. Wherever avascular necrosis is there, generally it is a non-union. Khatam. So this is a fracture neck of femur with avascular necrosis of the head of the femur. This is the what? Gun-stalk deformity. Okay? This is the fracture lateral condyle of the humerus where non-union is the problem. Then Finkelstein, De Quervain. Now De Quervain में which tendons बोल के पूछेगा examiner. Abductor pollicis longus and extensor pollicis brevis. Lift off belly press test used in subscapularis tear. Job's test for supraspinatus tear. Try करो. It's like eating a last 3 days is like eating a what? Sandwich. Then little because waste हो जाता ना. क्या French fries और चाय भी पीना है, उसको डाइजेस्ट करने के लिए सोडा भी पीना है. So somehow Gerber lift off, garbage को lift करेगा ना रे. Subscapularis. Job supraspinatus. Go to Job supraspinatus. Spurling cervical radiculopathy. Squaring of pelvis, adduction abduction deformity. Steinberg thumb signal or Walker's test is Marfan. ऐसा लगाए तो ये बाहर निकलेगा, सबको आएगा. ये हाँ इनके कौन है? So lift off test. Garber. ये Garber क्या है? Subscapularis. Then supraspinatus के लिए Job, arm abducted in the plane of the scapula, thumb pointing downward, resist elevation of the arm. इसको supraspinatus. Job. No job. Spurling is cervical compression. This is barber करते ना. खत्म. Then Steinberg. చెత్త అయిపోయింది, ఖతం అయిపోయింది చెత్త. Now अच्छा, valgus, it will stick medially, that is gum. Vinisha. और mnemonic, queen of mnemonics, Vinisha बोलता है valgus, it will stick medially, that is gum. Good. Now, what are the drugs used in osteoporosis? If I can finish in another 1 hour orthopedics, I'll get Nobel Prize for orthopedics this year. Huh? At least Oscar award for, not. So Oscar award for teaching. So what drugs, you have energy, right?
Yeah.
What drugs inhibit resorption? What will stimulate formation? Both. Biphosphonates, denosumab, calcitonin, estrogen, gallium nitrate, they all inhibit resorption. You don't lose money. They stop first losing money. Who will earn you money? Teriparatide, calcium, calcitriol and fluorides. Both actions are there only for strontium ranelate, and that is going to come in the tomorrow's NEET PG 2023. Right, Doc? Now, 4 most commons about fractured supracondylar humerus. Most common fracture associated with vascular injury is supracondylar. Vascular injury. Most common fracture to involve brachial artery, obviously. वही होता है क्या? Patella होगा नहीं. Most common cause of Volkmann ischemic fracture and compartment syndrome in children is supracondylar. Most common cause of Volkmann ischemic contracture overall is also supracondylar. And what are the various fractures where you need to do open reduction and internal fixation instead of closed reduction? Yeah. I mean, what are the fractures where you need to give face-to-face live classes, no more online classes? That is closed reduction. Live face-to-face open reduction and internal fixation, like a brain. Bita subject ko. Fracture lateral condylar humerus. Chances of displacement are there because of the common extensor origin. Fracture patella because of the pull of the quadriceps. Fracture of olecranon because of the pull of the triceps. In all this, you need to do open reduction and internal fixation. So you do tension band wiring for transverse fracture of patella, olecranon, and 5th metatarsal. 5th metatarsal, little toe. So this is what you call tension band wiring. Abhi aa gaya next. Composite splint. Slides are not moving. Ayo. Change na? We should jail na hoda. We should akkar lagera. So good. Can online students can punch? Is the voice loud and clear and broadcast smooth? No. Cock up splint, radial nerve palsy, because it will lead to cock down. Then knuckle bender. Knuckle bender. Allah nerve palsy में क्या होता? Clawing होता ना? Clawing में knuckles क्या हो जाता? Hyper extension में होता. इसको bend करो. Knuckle bender. Aeroplane splint. Brachial plexus injury. Thomas Bowler Braun fracture femur. Von Rosen Pollock Harris and Craig splint is congenital dislocation. Dennis Brown congenital talipes equinovarus. Volkmann or turnbuckle, that also is like this. Volkmann's or turnbuckle. Gunning splint is fracture mandible. गन लगा के मारे तो मैंडिबल ब्रेक हो गया, उसको फिल गनिंग स्प्लिंट. क्रेमर्स वायर स्प्लिंट. There's a beautiful movie, Kramer versus Kramer. टाइम मिले तो देखो. ओल्ड 1982 का मूवी है. मेरिल स्ट्रिप का मूवी है. Then Velpue dressing or sling and swath bandage used for immobilizing shoulder and humerus.
Just leave.
Velpue dressing. So already you know Kilonevin sign and introitious branch of median nerve. This is what Dr. Cock-up splint, radial nerve injury. Knuckle bender splint, ulnar nerve. Aeroplane splint, brachial plexus. Bowler bronze splint, femur. Bowler bronze splint, femur. Pollick's harness, congenital dislocation. Dennis Brown splint, CTEV. Walkman's turnbuckle splint, Walkman's. Gunning splint, mandible fracture. Kramer's wire splint, emergency for long bone. Velpue dressing or swing and swath bandage, वो तो general है. अम्मया. Next year traction, right? So NEET PG last moment preparation is like Hindu marriage. ముందు తలంబ్రాలు, తర్వాత మంగళసూత్రం కట్టడము, తర్వాత అబ్బాయి అమ్మాయి అట్లా ఒక్కటి. నేను ఆయన పురోహిత్ ఎలా ఓలా బోల్తావు మే. क्रिश्चियन मैरिज है तो इजी है, सम्मतमा सम्मतमा सम्मतमे, फिनिश. गॉड ब्रिंग्स द यूनियन, खत्म. इधर तो गेम्स रहता, ओलंपिक्स रहता, सब कुछ रहता हिंदू मैरिज में. Then Dunlop Smith traction, where do we use? Supracondylar fracture. Gallows traction, Brion's traction is for fracture shaft of femur in less than 2 years age. Russell's traction for fracture of shaft of femur 2 to 10 years. 90-90 traction, fracture shaft of the femur in 10 to 15 years. Perkins traction, fracture shaft of femur in adults.
In Perkins thesis, children will feticide.
P for pediatrics, huh?
Perkins are moving with the
Oh, okay.
We got it. There's this governess, she's a match, so fairy comes to take the children.
Okay. Perkins is adults. Mala cheppadi, quick ga cheppadi. Dunlop Smith, SCF. Gallo Brion, less than 2 years. Russell is 2 to 10 years. 90-90, femur 10 to 15. Perkins is adult. Crutchfield, cervical spine. Halopelvic traction, thoracic lumbar spine. Buck's traction, conventional skin traction को buck बोलते हैं. Buck's fascia, buck, 5 to 7 kg. Agnes Hunt well-legged traction is hip deformity. K-wire Steinman pin, skeletal traction, less than 20 kg weight permitted. Denham pin, skeletal traction, cancellous or osteoporotic bone है तो Denham pin. फटाफट बोलो. Dunlop traction, supracondylar fraction. Brion traction,
Less than 2 years for femur.
less than 2 years for femur. Femur fracture shaft of the femur. Then Gallows Brion traction also between
Russell's less than 2 years.
huh?
Less than 2 years.
Less than 2 years. Russell's traction
2 to 10 years.
2 to 10. Then 90-90 10 to 15. Sites of skeletal traction, olecranon पे distal femur को, proximal tibia को, calcaneum को, distal tibia को आप hook लगा सकते हो. Then olecranon, distal femur, proximal tibia, distal tibia, calcaneum को hook लगा सकते हैं. Next doctor, this is what? Proximal tibia को hook लगा सकते हैं. Then Crutchfield traction for cervical injury. Halopelvic traction for scoliosis. Buck's traction for skin traction. Buck, then well leg traction
Again, the femur.
Deformed hip is stabilized by splint. Steinman pin ऐसा होता है, कल के नीट पीजी में ये देगा और क्या बोलेगा? Hair pin. Then this is what K-wipe. K-wipe. ये सब इमेज बेस्ड क्वेश्चंस हैं. ये है Dunham pin, इवन ऑस्टियोपोरोटिक बोन को भी इसका थ्रेडिंग्स देखो. मगर आपके स्टीनमैन में थ्रेडिंग नहीं है, उधर थ्रेडिंग है. मुरली Bharadwaj tailoring classes. Now, good. The 9 casts. Minerva cast, Somi brace, cervical spine injury. Hanging cast, sugar tongue cast, U-slab, fracture shaft of humerus. Risser's Milwaukee turnbuckle, scoliosis. Colles handshake cast. Fracture lower end of the radius, which is Colles. Cast in glass holding position, fracture scaphoid. Broomstick Petri is leg cow Parthi. Frog leg Lorenzo Bachelor is for congenital dislocated hip. PTB is fracture tibia. Bachelor को congenital dislocation, abduction. అయ్యో 10-18 చాలా లేట్ అయిపోతుందేమో. సిలిండర్ ఆర్ ట్యూబ్ క్యాస్ట్ ఫర్ ఫ్రాక్చర్ పెటెల్లా. నాకు కూడా తెలియలే టైం. हाँ, so इसको बोलो डॉक्टर फटाफट. This is Minerva Cafe. This is hanging cast. This is Milwaukee brace in scoliosis. This is handshake Colles. This is handshake technique. Colles pain. Glass holding, scaphoid cast. Broomstick, like broomstick. Broomstick ऐसे रहता. It got named like that only. You know, if you got the point. Broomstick. Broomstick Petri's cast. Hip abduction brace cast. This is broomstick. This is Scotty Reety. This is Bachelor. I mean, this is congenital dislocation में आप 3 कैस्ट लगाते ना. What are they? Frog leg, Lorenzo, plus everything is abduction to maintain the relocation. Now, doctor, shoulder. నాకు లేట్ అయితే భయం అవుతుందమ్మా. మళ్ళీ జాగ్రత్త పోవాలి కదా ఇంటికి. మీరు 10:20 అయిపోయింది. మరి లైట్లు కూడా ఆఫ్ చేసిండు. फिर भी अरे आई एम ए जेरियाट्रिक फादर. Figure of 8 bandage is used in clavicle fracture. Klippel-Feil syndrome में what is the triad? Short neck, low hairline, restriction of neck movement associated with springal deformity. This is called figure of 8 bandage. This is the springal deformity. Springal deformity में क्या हो गया? Short neck, low hairline, and along with the scapula is high placed. Dislocation of shoulder. Tomorrow we'll read. Tomorrow fresh ఎన్ని గంటలకి రాగలుగుతారు మీరు? ఎర్లీ గెస్ట్ 8. ఎందుకంటే వీడు 7 దరిద్రుడు లిఫ్ట్ ఆన్ చేయడు. సో అందుకోసం 8 o'clock. I can come much earlier also, but 8 to 1 o'clock गर्मा गर्म पढ़ के मैं घर जाके 2-3 घंटे सो जाके फिर शाम OPD को आता हूँ. राइट? हाँ, गुड. But you are all happy, right? So remember, crying is what 2 lakh students will do. Everybody आप उसको ऐसा स्क्रैच करे तो भी परीक्षा में आबो 2 రోజుల్లో they will cry. But 10,000 बच्चे अभी हंसते हुए पढ़ते हैं. I want you to be that. There is no tension at all.
Just to be angel man.
Correct.
Yeah.
So enjoy, and tomorrow early morning हम remaining orthopedics खत्म करेंगे.
Next year 7 o'clock we will start from home.
Huh?
7 o'clock message pattern will start here.
Sure. 7, when I start at home, I'll keep it. Thank you all the online students. Enjoy preparation, no tension at all, right? And let us see what best we can do in the next 2 days. Thank you. Thank you, Sanjay, for saying we are all very happy, sir. Thank you, Yamini, for saying you are our stress buster.
Sir, MDS paper वाला फोन है सर. फर्स्ट मार्च में MDS एग्जाम